On January 24, 2023, Lindsay Clancy caused the deaths of her 3 young children inside her family's home in Duxbury, Massachusetts. That fact is not in dispute. What is in dispute, what an entire criminal trial in 2026 was built around, is what was happening inside Lindsay Clancy's mind when she did it, and whether the law holds her responsible for it. This documentary reconstructs that case from the evidence outward. It draws on trial testimony, contemporaneous medical records, digital forensics, and the accounts of the people who knew Lindsay Clancy before her name became attached to a criminal case. Some of what follows is established fact. Some of it is what Lindsay herself later reported. Some of it is what witnesses observed, what clinicians documented, or what psychiatric experts called by opposing sides concluded after studying much of the same material and arriving at very different answers. We will try to keep those categories distinct as we go. When something is established, we will say so. When it is an allegation, a recollection, or an expert's opinion, we will identify it that way. And when the evidence itself cannot resolve a question, we will not pretend that it can. Our goal is not to tell you what to conclude. It's to give you what the record actually contains, so you can weigh it yourself. This is where it begins, not with the months that came before, but with a single afternoon in January. Much of January 24, 2023, looked outwardly routine. Earlier that day, Lindsay Clancy took her 5-year-old daughter, Cora, to a pediatric appointment. It was an ordinary parenting activity. It does not tell us what was happening inside Lindsay's mind. It establishes only what she was doing. Later that afternoon, the family was home in Duxbury, Massachusetts. Patrick Clancy, Lindsay's husband, was working from a home office in the basement. Lindsay was upstairs with their 3 children, Cora, 5, Dawson, 3, and Callan, 8 months old. At approximately 4:47 p.m., Lindsay called a nearby CVS pharmacy and asked about children's Miralax. The employee who took the call later testified that she had no difficulty understanding Lindsay and noticed nothing unusual about the conversation. That observation matters, but its limits matter too. A pharmacy employee's impression during a brief phone call cannot, by itself, establish someone's psychiatric condition. A few minutes later, at approximately 4:53 p.m., Lindsay texted Patrick about ordering dinner from 3V Restaurant. Patrick agreed. The two exchanged messages about what they wanted to order. At approximately 5:10 p.m., Lindsay called the restaurant and placed the order. The employee who spoke with her later testified that Lindsay was understandable and that she noticed nothing unusual during the call. Again, that is evidence of how Lindsay sounded during a specific conversation. It is not a psychiatric evaluation. After placing the restaurant order and before Patrick left the house, phone records showed Apple Maps activity concerning the route between the family's home and 3V. Prosecutors consider that significant. They argue Lindsay was determining how long Patrick would be away from the house. That is the prosecution's interpretation of the digital evidence. What is established is that the route was checked. Why Lindsay checked it is part of what the two sides dispute. At approximately 5:15 p.m., Patrick left the house. He had 2 errands. First, CVS, where he would pick up medication for one of the children. Then 3V, where he would collect the family's dinner. His departure left Lindsay alone in the house with Cora, Dawson, and Callan. At approximately 5:33 p.m., while Patrick was at CVS, he called Lindsay. She did not answer. About a minute later, Lindsay called him back. The call lasted approximately 14 seconds. Patrick later testified that Lindsay was quiet and sounded as though she was busy. He recalled thinking she might have been occupied with something involving the children. The evidence does not establish what Lindsay was actually doing during those 14 seconds, and this account will not attempt to fill in the gap. Patrick purchased the medication and left CVS. At approximately 5:54 p.m., surveillance footage showed him picking up the takeout order at 3V. Then he drove home. During the period Patrick was away, Lindsay strangled Cora, Dawson, and Callan inside the family's home. Afterward, Lindsay injured herself and went through a second-story window, falling to the ground outside and suffering severe spinal injuries. Patrick arrived home at approximately 6:09 p.m. He later testified that the house was quiet. He could not find Lindsay or the children. He called Lindsay's phone. Then he went upstairs. In the bedroom, he found an open window and evidence that something serious had happened. Outside the house, he found Lindsay badly injured on the ground. Patrick called 911. The call lasted approximately 7 minutes. Jurors heard the recording during Lindsay's 2026 trial. Patrick initially remained outside with Lindsay while speaking with the dispatcher. Once first responders arrived and began treating her, Patrick went back inside to look for the children. He found them in the basement. Cora and Dawson died that night. Callan was transported for medical treatment. He died 3 days later on January 27th. The central physical fact of this case is not disputed. Lindsay Clancy caused the deaths of all 3 of her children. Her defense does not argue otherwise. The question now, before the jury, is different. Was Lindsay criminally responsible for what she did? Prosecutors point to the sequence of January 24th, the pharmacy call, the restaurant order, the Apple Maps activity, the errands, the apparently coherent conversations, and the period when Patrick was away from the house. The state argues that these actions show someone capable of deliberately creating an opportunity to be alone with the children and acting intentionally once that opportunity existed. Lindsay's defense reads the same afternoon differently. Her attorneys do not dispute the core sequence of events. Instead, they argue that outwardly organized behavior existed alongside a severe psychiatric deterioration that had been unfolding for months. They contend Lindsay was suffering from psychosis and was not criminally responsible when she killed the children. Those are 2 fundamentally different interpretations of the same day. One focuses on organization, opportunity, and intent. The other asks whether a person can appear organized in certain moments while still experiencing a severe break from reality. This documentary cannot answer that question by looking at January 24th alone. Because January 24th did not begin on January 24th. For months beforehand, Lindsay had been telling people that something was wrong. She sought psychiatric treatment. She saw multiple providers. She took multiple medications. She entered a psychiatric hospital. She reported intrusive thoughts. And eventually, she returned home. To understand what happened in Duxbury, we have to move backward, before the medications, before the hospitalization, before the psychiatric records that would later be read aloud in a murder trial, before anyone outside her family and community knew Lindsay Clancy because of this case. We have to understand who she was first. Before Lindsay was a case, before psychiatric records, medications, and a murder trial became the way the public knew Lindsay Clancy's name, her biography looked very different. Lindsay Marie Musgrove was born on August 11, 1990, and grew up in Wallingford, Connecticut. She graduated from Lyman Hall High School in 2007. She then attended Quinnipiac University, where she participated in competitive cheerleading and graduated in 2012 with a bachelor's degree in biology. After college, Lindsay moved toward nursing. She earned a nursing degree from the MGH Institute of Health Professions in Boston and became a registered nurse. Eventually, she joined the labor and delivery unit at Massachusetts General Hospital. She would work there for years. Her job placed her inside one of the most intimate parts of medicine: pregnancy, labor, childbirth, newborn care, and families experiencing the first hours of a child's life. There is no need to turn that profession into irony because of what happened later. At this point in the story, nursing was simply Lindsay's career. A former co-worker, Margaret Hamp, later testified that Lindsay loved the work and described her as compassionate, kind, and a patient advocate. Hamp said Lindsay was the type of nurse she would have wanted caring for someone she loved. Lindsay also worked night shifts, Records later filed by Patrick Clancy said she eventually reduced her schedule to part-time nights so she could spend more time at home with her children. Lindsay married Patrick Clancy in December 2016. The couple eventually settled in Duxbury, Massachusetts. Their first child, Cora, was born on December 24, 2017. Patrick later described Cora as a little girl who loved princesses and had many friends. Their second child, Dawson, was born on September 30, 2019. Patrick described him as energetic and funny, with a particular love of trucks and Paw Patrol. Those details do not need embellishment. They simply allow Cora and Dawson to exist in this account as children with interests and personalities, rather than only as names attached to what happened in January 2023. The record also contains an important baseline concerning Lindsay's earlier experiences after childbirth. In a civil complaint filed years later, Patrick described Lindsay as experiencing some anxiety after Cora was born and stronger anxiety after Dawson's birth, particularly as the end of maternity leave approached. According to that account, Lindsay managed those earlier periods through things like exercise, diet, meditation, socializing, and, after Dawson's birth, several therapy sessions. Those earlier experiences matter because Lindsay had already encountered anxiety connected to childbirth and returning to work. But they should not be retroactively treated as evidence that the severe psychiatric crisis documented in late 2022 was inevitable. For years, Lindsay continued working. She and Patrick continued raising their children. Trial evidence included ordinary photographs, videos, and messages from that family life, birthdays, trips, activities with the children, everyday communication between two parents coordinating a household. Those images do not prove that a family was psychologically perfect. Family photographs cannot do that, but they establish that there was a substantial life before the period that would later dominate the criminal trial. People who actually observed Lindsay with the children also described her parenting. Elaine Rossi began working as a nanny for the Clancy family in September 2022. Rossi later testified that she considered Lindsay a wonderful mother. She described her as caring and attentive with the children. Other witnesses, including people who knew Lindsay personally and professionally, also described her in positive terms. Those are witness observations. They should not be converted into an objective declaration that Lindsay was a perfect mother or that no serious mental illness could have existed. Rossi's testimony becomes particularly important later because she also saw Lindsay during the months when her condition was changing. That part belongs to the next stage of the story. Before then, the family grew again. On May 26, 2022, Lindsay gave birth to the couple's third child, Callan. Patrick later described him simply as a happy baby. Cora was 4, Dawson was 2, and now Lindsay and Patrick were raising 3 children under 5. Both parents took parental leave after Callan was born. Patrick's leave was scheduled for approximately 12 weeks, Lindsay's for approximately 18. Patrick later described those early months after Callan's birth positively. The family spent time together. They visited relatives. They went to the beach and pool. Lindsay returned to exercising. Patrick and Lindsay even ran road races during that period. None of those activities is a psychiatric assessment. They establish only that the early postpartum period contained ordinary family activity and moments Patrick remembered as happy. Then summer began turning toward fall. Patrick's parental leave ended. Lindsay's own return to work approached, and the record starts becoming much more detailed. In September 2022, Lindsay began telling a psychiatrist that she was anxious, overwhelmed, having difficulty sleeping, worried about caring for 3 children, and increasingly concerned about returning to work. For the first time in this story, we no longer have to rely primarily on photographs or memories of family life. We begin to have contemporaneous psychiatric records, appointments, questionnaires, diagnoses, prescriptions, Lindsay's own descriptions of what she was experiencing. That is where the investigation into her mental state really begins. The return to work. By the summer of 2022, the Clancy household had settled into the rhythm of caring for a newborn alongside two older children. Callan had been born on May 26th. Both Lindsay and Patrick took parental leave, his lasting approximately 12 weeks, hers scheduled for about 18. Patrick later remembered much of that early stretch positively. Time at home, visits with relatives, trips to the beach and pool. Lindsay exercised during this period and participated in road races. None of that establishes her psychiatric condition. It establishes what the family was doing. When Patrick's leave ended, he returned to work, though he was able to work from home. Lindsay remained on maternity leave with 3 young children. Her own return to work was approaching. Patrick later said that returning to work had also been associated with anxiety for Lindsay after her earlier pregnancies. That history provides context. It does not establish that returning to work caused what followed. By September, Lindsay was reporting increasing anxiety and sought psychiatric care. On September 15, 2022, she met for the first time with psychiatrist Dr. Jennifer Tufts of Astor Mental Health. Tufts would later testify during Lindsay's 2026 trial. Much of what is known about this period comes from the clinical record created while Lindsay was actually being treated. At the September 15th appointment, Lindsay reported feeling anxious and overwhelmed caring for 3 children. She was worried about Callan refusing to take a bottle. She was also concerned about returning to work. Screening material from that visit documented a range of symptoms Lindsay reported: anxiety attacks, decreased appetite, depressed mood, distractibility, excessive worry, guilt, difficulty experiencing pleasure, difficulty falling asleep, and racing thoughts. Those were reported symptoms. They should not automatically be treated as things Tufts personally observed during the appointment. The distinction matters. The same visit also created an important baseline concerning self-harm and harm to others. Lindsay completed a suicide risk assessment. She denied current suicidal thoughts. She denied hearing voices telling her to hurt herself or someone else. And she denied thoughts of killing or seriously harming another person. That establishes what Lindsay reported on September 15th. It does not establish what she would experience later. Based on the information available to her at that time, Tufts diagnosed Lindsay with generalized anxiety disorder and adjustment disorder with depressed mood. Those were the treating psychiatrist's contemporaneous diagnoses. Tufts prescribed sertraline, commonly known as Zoloft. The initial dose was 25 milligrams daily, with instructions to increase to 50 milligrams after 1 week. She also recommended individual therapy. Lindsay did not immediately start the medication. At a September 28th follow-up appointment, she told Tufts that she had filled the prescription but had decided not to take it. The treatment record describes her as reluctant about medication and concerned about taking it. She wanted to try other approaches first. The important chronology is straightforward. Zoloft was prescribed September 15th. By September 28th, Lindsay had not started it. That changed in October. At her October 20th appointment, Lindsay told Tufts she had begun taking 25 milligrams of Zoloft approximately 1 week earlier. The night before the appointment, she increased the dose to 50 milligrams as originally instructed. She then reported feeling considerably worse. Tufts later read from her notes in court. Lindsay reported that she could not sleep. Her insomnia had worsened after increasing the dose. She did not want to eat. She had diarrhea. She felt more depressed. She had been crying. She described mental fog. She said she was terrified to begin another medication. Her anxiety, she said, had already been severe before the Zoloft and was now difficult to separate from how the medication made her feel. She also reported racing thoughts overnight, and Tufts documented a phrase that would later receive significant attention in court. Lindsay was paranoid of getting suicidal thoughts. She also expressed fear of something bad happening and said she did not want to be alone. Those words need to be read carefully. Being afraid that suicidal thoughts might develop is not the same thing as reporting an active plan to die by suicide. Tufts later made that distinction during testimony, but she also acknowledged that the report concerned her. After hearing Lindsay's symptoms on October 20th, Tufts instructed her to stop taking Zoloft. At that dose, Tufts testified, it could be discontinued without tapering. The record from this point does not show Tufts diagnosing psychosis. It does not show Lindsay reporting hallucinations. And it does not show Lindsay telling Tufts that she intended to hurt herself or her children. What it does show is worsening anxiety, insomnia, racing thoughts, depressed mood, and fear that her mental state might deteriorate further. Years later, the significance of this treatment period would become disputed. Lindsay's defense would argue that her worsening symptoms and reactions to antidepressant treatment belonged to a larger psychiatric process that had not yet been correctly identified. Tufts testified that she later considered diagnoses including bipolar disorder, but did not believe Lindsay met the required criteria during the period she treated her. Those competing interpretations belong later. At this point in October 2022, the established chronology is more limited. Lindsay sought help because she was anxious and overwhelmed. Her first psychiatric medication was prescribed. She initially declined to take it. She eventually began it. After increasing the dose, she reported feeling significantly worse. And on October 20th, Tufts stopped the Zoloft. The medication stopped. The symptoms did not. Sleep would become an increasingly serious problem. More appointments would follow. More medications would be tried. And within less than a month, Lindsay would seek treatment in an emergency room because she could not find relief. Sleep. On October 21st, one day after Dr. Jennifer Tufts told her to stop taking Zoloft, Lindsay Clancy met with her again. Lindsay reported that she had not slept the night before and was experiencing severe anxiety. Tufts prescribed lorazepam, commonly known as Ativan, at 0.5 milligrams, to be taken as needed for severe anxiety. It was the lowest dose. Tufts also continued recommending individual therapy. By October 26th, Lindsay told Tufts that she felt closer to how she had felt before taking Zoloft. That did not mean she felt well. The anxiety and sleep problems remained. At that appointment, Lindsay reported that Ativan seemed to reduce some of her anxiety, but was not solving the sleep problem. She also said she had been taking Benadryl and thought it had helped somewhat. Tufts adjusted the treatment plan again. Ativan was increased from 0.5 milligrams to 1 milligram as needed. Buspirone, commonly called Buspar, was introduced at a low dose for anxiety. Tufts also discussed hydroxyzine, a prescription antihistamine that can be used for short-term anxiety and can cause sedation. 5 days later, on October 31st, Lindsay also attended therapy through Astor Mental Health. Records later cited in civil litigation describe her telling the therapist that she hoped to return to work and believed getting back to work might help some of her depression symptoms. It is a detail worth preserving without assigning it more meaning than it can carry. Even while struggling, Lindsay was still talking about a future in which she returned to nursing. That does not establish whether she was or was not at psychiatric risk. It establishes what she was saying at the time. On November 2nd, Lindsay saw Tufts again. Tufts continued diagnosing generalized anxiety disorder and adjustment disorder with depressed mood. The Ativan dose was reduced back to 0.5 milligrams. Buspirone remained among the medications being considered for her anxiety. A second prescription for Buspirone was filled on November 9th. Evidence introduced at trial later suggested Lindsay took very little of the Buspirone she had been prescribed. That becomes an important limitation whenever the medication history is discussed. A prescription record tells us that a medication was prescribed and filled. It does not automatically tell us how consistently the patient actually took it. By this point, Lindsay's psychiatric treatment was increasingly becoming an effort to address several problems at once: anxiety, depressed mood, and, increasingly, sleep. Different medications were being prescribed, adjusted, or discontinued as Lindsay continued reporting symptoms and concerns about side effects. That is different from saying the medications caused what came later. At this stage, the record establishes treatment changes. It does not establish causation. Outside the treatment room, people around Lindsay were also noticing changes. Elaine Rossi, the nanny who worked with the Clancy family during the fall of 2022, later testified that Lindsay told her she was struggling with postpartum mental health problems and could not sleep. Rossi said Lindsay had lost a noticeable amount of weight. She also knew Lindsay had begun sleeping in the basement. Patrick later described the sleep arrangement in more detail. He initially slept downstairs for a short period in an effort to give Lindsay more uninterrupted sleep. Then Lindsay began sleeping in the basement herself. There is no evidence that this arrangement reflected a marital separation. In the context of the testimony, it was part of the household's attempt to deal with Lindsay's inability to sleep. But the insomnia persisted. By mid-November, records later cited in Patrick Clancy's civil lawsuit described Lindsay as sometimes sleeping only approximately 3 hours a night. That figure was not measured every night, but it is consistent with the broader treatment record showing that sleep had become one of her most persistent complaints. On November 16th, the problem led Lindsay to seek emergency medical treatment. She went to the emergency room at South Shore Hospital. Records from the period describe insomnia, continuing anxiety, and episodes of heart racing or palpitations. She was prescribed trazodone. The initial prescription was 50 milligrams, with the medication being used in this context to try to help her sleep. The significance of the visit is not simply that another prescription was added. Lindsay's inability to sleep had reached a point where she went to an emergency department looking for relief, and according to the records that followed, the trazodone did not adequately solve the problem. Lindsay continued reporting severe difficulty sleeping. 4 days later, on November 20th, another member of the family became involved in finding additional psychiatric care. Patrick's mother, Susan Clancy, was a nurse at South Shore Health. She contacted Julie Paul of South Shore Health's perinatal behavioral health program and asked Paul to speak with Lindsay. Paul was both a psychiatric mental health nurse practitioner and a certified nurse midwife. She had helped establish a program specifically serving patients dealing with mental health conditions during pregnancy and the postpartum period. Paul spoke with Lindsay by telephone. Lindsay told her she had done well during approximately the first 12 weeks after Callan's birth but had struggled afterward. She described the psychiatric treatment she had already received. She told Paul she had gone to the emergency room. She listed medications she had been prescribed. And she told Paul that one of her goals was not to remain on psychiatric medication long-term. Sleep remained central. Lindsay said trazodone had not adequately helped. During that initial conversation, Paul also conducted a safety assessment. Lindsay denied suicidal thoughts. She denied homicidal thoughts. She denied visual or auditory hallucinations. Paul testified that Lindsay did not appear delusional during the conversation and that there was no immediate safety issue requiring emergency intervention, based on what Lindsay reported. Again, this establishes what Paul heard and observed on November 20th. It does not settle what Lindsay's ultimate diagnosis should have been. Paul scheduled a formal intake for the following day. By then, Lindsay's treatment had expanded beyond one psychiatrist. She had tried Zoloft, Ativan, Buspirone, Benadryl. Hydroxyzine had been considered as another option. An emergency room doctor had prescribed trazodone, and still, sleep remained a problem. The number of medications is easy to focus on, but the more important fact at this stage is why the treatment kept changing. Lindsay kept reporting that she was not getting the relief she was looking for. By November 20th, that search had brought another psychiatric provider and another health system into her care. What happened over the next 10 days would make that treatment history considerably more complicated. The medications. On November 21st, 2022, Lindsay Clancy had her formal intake appointment with Julie Paul, a psychiatric mental health nurse practitioner at South Shore Health's perinatal behavioral health program. Paul later testified that Lindsay described severe insomnia increased anxiety, feeling overwhelmed, racing thoughts, and being both frustrated and scared by what she was experiencing. Lindsay told Paul that she had done relatively well for approximately the first 12 weeks after Callan's birth. Then things had become more difficult. She had delayed her return to work because of the anxiety. She also walked Paul through the psychiatric treatment she had already received and the medications she had already tried. And she told Paul something that would recur throughout the treatment record. She did not want to remain on psychiatric medication long term. Paul also conducted a safety assessment. Lindsay denied suicidal thoughts. She denied homicidal thoughts. She denied auditory hallucinations. And she denied visual hallucinations. Paul testified that Lindsay did not appear delusional. Based on what Lindsay reported and what Paul observed during that assessment, Paul did not believe there was an immediate safety issue requiring emergency intervention. That establishes what Lindsay reported on November 21st. It does not establish what she would experience later. Paul prescribed fluoxetine, commonly known as Prozac, at 10 milligrams. Lindsay had reported taking Prozac previously while in nursing school, without recalling significant side effects. The plan was to use Ativan temporarily to help control anxiety while waiting for the Prozac to begin working. Paul testified that medications like Prozac generally require time before their full therapeutic effects can be evaluated. Lindsay began taking the Prozac the following day. She would take it for only about 3 days. Within that short period, Lindsay reported that she did not like how she felt. She described feeling disconnected, out of it, spacey. She continued struggling with sleep. On November 25th, Paul recommended that Lindsay stop taking Prozac. The treatment plan changed again. Paul prescribed a one-time 5 milligram dose of Ambien to help with sleep. She prescribed 5 milligrams of mirtazapine, commonly known as Remeron, an antidepressant that can also have sedating effects, and she prescribed 0.5 milligrams of clonazepam, commonly known as Klonopin, for anxiety and sleep support. Paul specifically instructed Lindsay not to take Ativan while using Klonopin. Within several days, the treatment strategy had moved from Prozac with temporary Ativan to a different combination because Lindsay continued reporting side effects and difficulty sleeping. That chronology is important, but chronology does not establish causation. The fact that Lindsay reported a symptom after beginning a medication does not, by itself, prove that the medication caused the symptom. That question would later become heavily disputed. On November 26th, Lindsay contacted Paul again. Paul testified that Lindsay reported some improvement and asked whether one of the medications being used to help her sleep could be increased slightly. Paul permitted a modest adjustment. The two were communicating frequently. Lindsay would report how she was feeling. Paul would respond. And the treatment plan continued to change. On November 27th, Lindsay reported that she had slept well. But she also told Paul that she felt disconnected from herself. Lindsay chose to discontinue the Klonopin. The following day, November 28th, she contacted Paul again. This time, Lindsay reported having a panic attack. Records from this period also describe her saying she felt disoriented, forgetful, not connected to her body. She sometimes woke feeling hung over, and she had become intensely worried that she might be developing a physical dependence on benzodiazepines. That was Lindsay's fear. It should not be converted into a diagnosis of addiction. Providers who later testified did not believe she had become addicted to the medications at that point. On November 28th, Paul also suggested that Lindsay consider a partial hospitalization program. A partial hospitalization program is a higher level of psychiatric treatment that generally allows a patient to receive intensive care during the day without remaining in a hospital overnight. Lindsay told Paul that the option would be difficult logistically at that time. That is different from saying she rejected psychiatric care. She continued actively seeking treatment. Around the same time, Julie Paul was preparing to leave the perinatal program. Another psychiatric nurse practitioner at South Shore Health entered Lindsay's care. Rebecca Gelata. Gelata first met with Lindsay virtually on November 29th. She later testified at Lindsay's 2026 trial. During that first appointment, Gelata described Lindsay as anxious, but she described Lindsay's thought process as linear and goal-directed. She did not observe symptoms she interpreted as mania. She did not observe psychosis. She did not observe hallucinations or delusional behavior. And Lindsay did not report thoughts of harming her children. A postpartum depression screening produced a score of 17 out of 30, which Gelata characterized as moderate symptoms. She also assessed significant anxiety. One of Lindsay's central concerns remained medication. She repeatedly expressed fear that she was becoming physically dependent on benzodiazepines, such as Ativan and Klonopin. Again, the distinction matters. Lindsay feared dependence. Gelata did not believe the available evidence showed that she was addicted. At the November 29th appointment, Gelata did not prescribe a new medication. She recommended that Lindsay continue the existing plan, including Remeron and Ativan as needed. She also recommended non-medication approaches, therapy, mindfulness, physical activity, and meditation. The following day, November 30th, Paul formally transferred Lindsay's care to Gelata, and Lindsay began sending Gelata a series of messages through the patient portal. Her depression, Lindsay wrote, felt much, much worse. She reported sleeping only about 2 hours. She did not like how she felt on Remeron. She felt hopeless. She lacked motivation. Gelata asked directly about suicide. Lindsay told her she was not at the point of being suicidal. But she also said, "I'm really feeling like I can't go on like this." Those statements exist together in the record. Lindsay was explicitly denying that she had reached the point of being suicidal. At the same time, she was describing severe distress. Neither statement should erase the other. Gelata introduced another medication into the treatment plan, quetiapine, commonly known as Seroquel. Seroquel is classified as an atypical antipsychotic, but that classification does not mean Gelata believed Lindsay was psychotic. The medication can be used in the treatment of several psychiatric conditions. Gelata testified that she did not observe psychosis in Lindsay during this period. She was considering the medication in the context of persistent insomnia, anxiety, depression, and questions about whether Lindsay might have an underlying mood disorder. Valium also entered the treatment plan during this period as Gelata worked with Lindsay on her anxiety and her concerns surrounding benzodiazepines. Another diagnostic question was beginning to emerge: bipolar disorder. Gelata later testified that the possibility remained in the back of her mind. Some of Lindsay's reported symptoms, including periods of profound sleep disruption and strong reactions to antidepressants, caused Gelata to consider whether an underlying bipolar spectrum condition could be involved. But consideration is not diagnosis. At this point, Gelata did not believe Lindsay displayed enough symptoms to establish bipolar disorder. She had not observed mania. She had not observed psychosis. And no bipolar diagnosis had been made. The medication history itself also requires care. Public discussion of this case frequently reduces the treatment period to a striking number: 13 psychiatric medications. Evidence at trial indicates that across several months, Lindsay received more than 30 prescriptions involving 13 different drugs. But that does not mean she was taking 13 medications simultaneously. Some were replacements for others. Some were taken only briefly. Some prescriptions were stopped shortly after they began. And later examination of medication bottles suggested that some prescribed medications had been taken very little. A prescription tells us what a provider authorized. It does not automatically tell us exactly what was in Lindsay's body on a particular day. What the record shows during these 10 days is a rapidly changing treatment plan accompanied by frequent communication between Lindsay and her providers. Lindsay reported symptoms. She reported side effects. She expressed fears about medications. Paul and then Gelata adjusted recommendations in response. Lindsay's defense would later argue that the rapid medication changes, her reported reactions, and an underlying psychiatric illness contributed to her deterioration. Her treating providers testified that medication adjustments are part of psychiatric treatment, that Lindsay was actively participating in decisions about her care, and that they did not observe psychosis during this period. Those interpretations belong to the later dispute over what the treatment history ultimately means. At this point, the documentary can establish only what happened. By the end of November 30th, Lindsay had moved between psychiatric providers. Several medications had been started, stopped, or adjusted within a short period. She continued reporting severe insomnia, anxiety, depression, hopelessness, and a growing sense of disconnection. Her new provider was now considering whether something more complicated than anxiety and depression might be involved, and Sarah Quell had just entered the treatment plan. The following morning, Lindsay began sending messages describing something the record had not documented in quite this way before: intrusive thoughts. Intrusive thoughts. On December 1st, 2022, Lindsay Clancy sent Rebecca Jolata a new round of messages through the South Shore patient portal. She was still unhappy with how Remeron made her feel, and she wrote something that had not appeared in the record in quite this form before. I started getting very intrusive thoughts that I didn't have before. Jolata later testified that she responded by giving Lindsay information about intrusive thoughts as a symptom that can occur in postpartum anxiety and depression. She explained that antidepressants generally need more than a few days before their full therapeutic effect can be evaluated, and encouraged Lindsay to give the Remeron more time. She also directed Lindsay toward resources about postpartum intrusive thoughts, including materials such as "Good Moms Have Scary Thoughts." Lindsay apologized for sending so many messages. "I'm sorry for all of the messages," she wrote. "It's just a very scary time for me." That same day, Lindsay was also in contact with Dr. Jennifer Tufts, who continued treating her separately. Tufts testified that Lindsay described depression, serious difficulty sleeping, numbness, and intrusive thoughts. Tufts's notes recorded Lindsay describing a feeling that "I am going to die." She also documented Lindsay as saying she felt close to suicidal ideation. At the same time, Tufts testified that Lindsay denied active suicidal ideation, even while describing herself as feeling close to it. Those statements have to remain distinct. Lindsay was describing serious fear and hopelessness. She was not telling Tufts that she had an active suicide plan. Tufts discussed a higher level of treatment, including partial hospitalization. By this point, Lindsay was also interacting with more than one psychiatric provider. Tufts remained involved through Astor Mental Health. Jolata was treating her through South Shore's Perinatal Behavioral Health Program. That meant different providers were receiving different pieces of Lindsay's account at different times. The record should not be simplified into either extreme, that every provider necessarily knew everything Lindsay had told every other clinician, or that none of them communicated. What can be established is what each provider documented and testified they knew. On December 2nd, Lindsay told Jolata she had awakened during the night with intrusive thoughts. She said they subsided after she took Ativan. Lindsay remained deeply worried about becoming dependent on the medication. She told Jolata she was willing to try anything because she wanted relief. Jolata did not believe Lindsay was developing the dependence Lindsay feared. She questioned whether Lindsay's insomnia had actually begun before she started using Ativan. Those are two different pieces of evidence. Lindsay believed the medication might be contributing to her problem. Jolata's clinical assessment was that dependence was not the primary issue. The documentary cannot settle that dispute simply from the chronology. On December 3rd, Lindsay reported that she had not taken Ativan the previous night. She had slept poorly. She woke experiencing intrusive thoughts and depression. She then took Ativan in the morning and said she felt better afterward. Again, the record establishes sequence. Medication taken. Improvement reported afterward. It does not independently prove causation. At this point, it is worth explaining what the phrase intrusive thoughts means. Intrusive thoughts are unwanted thoughts, images, or impulses that enter a person's mind. They can occur in several psychiatric conditions. They can also occur without psychosis. And experiencing an unwanted thought is not the same thing as intending to act on it. That distinction becomes especially important in Lindsay Clancy's case. Later, experts would disagree sharply about the meaning of her symptoms. But during these December 1st through December 3rd communications, the treating providers generally understood Lindsay to be describing intrusive thoughts associated with depression, anxiety, or another possible mood disorder. Nothing in these particular communications documents Lindsay describing an external voice commanding her to act. That is not a minor distinction. Later in the case, Lindsay would describe something different, but not yet. On December 6th, Lindsay met with Gelada in person. Patrick attended with her. Gelada testified that Lindsay had not previously asked Patrick to join one of their appointments. Lindsay completed another depression screening. Her score was 21 out of 30. Gelada characterized that range as moderate to severe depression. She described Lindsay's mood as anxious, but Lindsay's thought process was linear and goal-directed. Lindsay did not report hearing voices. She did not report visual hallucinations. She did not disclose suicidal thoughts during the appointment, and she did not disclose homicidal thoughts. Gelada testified that she observed no psychosis and no mania. That is Gelada's contemporaneous clinical observation from December 6th. It is not the same thing as proving what Lindsay experienced during every hour outside that appointment. At this same visit, another diagnostic possibility was discussed explicitly: bipolar disorder. Gelada told Lindsay and Patrick that Lindsay might have an underlying bipolar disorder. One factor she considered was Lindsay's report that she had once gone approximately 48 hours without sleeping after taking Zoloft. There were other symptoms in the history as well: racing thoughts, sleep disruption, difficulty concentrating, and pronounced reactions to antidepressants. But Gelada did not diagnose Lindsay with bipolar disorder. She was considering it. Patrick disagreed. Gelada testified that he responded, "My wife is not bipolar." That statement should not be transformed into an accusation that Patrick interfered with Lindsay's treatment. The record establishes only that he disagreed with the possibility being discussed. Medication was also part of the December 6th conversation. Lindsay remained worried about benzodiazepines and wanted to reduce her use of them. Gelada developed a plan using Valium as part of a gradual taper. Lindsay also expressed concerns about continuing Seroquel. Lindsay and Patrick expressed interest in trying Prozac again. Gelada told Lindsay that she could discontinue Seroquel and discussed restarting Prozac. The plan lasted only briefly. On December 7th, Lindsay messaged Gelada after another difficult night. Her sleep had again been interrupted. She wrote, "I really need help." Gelada changed course. She recommended that Lindsay continue Seroquel and hold off on restarting Prozac. She also suggested that increasing the Seroquel might help. Gelada later testified that the possibility of bipolar disorder remained in the back of my mind. Again, a diagnostic consideration, not a diagnosis. On December 8th, Lindsay reported that she had slept well while taking Valium and Seroquel. She asked whether the Valium taper could be slowed. One better night did not resolve the broader pattern. Her symptoms continued fluctuating. On December 9th, Gelada spoke by telephone with both Lindsay and Patrick. Gelada testified that both described Lindsay's symptoms as acute. At that point, she recommended that Lindsay pursue a higher level of treatment through the perinatal program at Women and Infants Hospital in Rhode Island. By early December, two pictures were developing simultaneously in the medical record. Lindsay was reporting intrusive thoughts, hopelessness, severe insomnia, numbness, a feeling that she was going to die, and a sense that she was approaching suicidal thinking. Yet during an in-person clinical evaluation on December 6th, Gelada documented linear thinking, goal-directed thinking, no observed psychosis, no observed mania, no reported hallucinations, and no disclosed homicidal or suicidal thoughts. Those facts do not necessarily contradict one another. A person can report serious psychiatric symptoms and still communicate coherently during an appointment. What those symptoms ultimately represented is a different question. Severe depression and anxiety, a bipolar spectrum process, developing psychosis, medication effects, some combination? Experts would eventually offer very different answers. The contemporaneous record cannot be rewritten to make one of those later interpretations inevitable. For months, Lindsay Clancy had been receiving outpatient psychiatric care. By early December, the language in her records had changed. Not only anxiety, not only insomnia, now intrusive thoughts, hopelessness, fear of approaching suicidal thinking, and symptoms both Lindsay and Patrick would describe as acute. On December 9th, her provider recommended that she move toward a more intensive level of care through a specialized perinatal mental health program. The outpatient treatment had not ended, but the question was changing. It was no longer only which medication might help, it was becoming, did Lindsay need more care than ordinary outpatient appointments could provide? A higher level of care. On December 12th, 2022, Lindsay Clancy was still in contact with Rebecca Gelada. Gelada testified that Lindsay had been taking less Seroquel than recommended. A nurse also relayed that Lindsay wanted to stop psychiatric medication altogether. Lindsay told Gelada that Valium and Seroquel had at least been helping her sleep. But during the day, she continued feeling fatigued, depressed, emotionally numb. Gelada told Lindsay she believed she was struggling with postpartum depression, and she strongly recommended a partial hospitalization program. That word matters, strongly. By this point, Gelada was no longer recommending only routine outpatient appointments and medication adjustments. She believed Lindsay could benefit from a more intensive level of psychiatric treatment. In the meantime, she recommended continuing Seroquel and Valium in an effort to protect what sleep Lindsay was getting. Gelada did not testify that she believed Lindsay was psychotic. Throughout the period she treated her, Gelada said she did not observe psychosis. The following day, December 13th, Lindsay met with Gelada virtually. Lindsay said she was not experiencing active suicidal ideation at that exact moment, but she described what she called intrusive suicidal thoughts and thoughts of wanting to die. Those distinctions matter. Thoughts involving suicide are serious. But thoughts about dying are not automatically the same thing as having a plan or intention to act. According to Gelada, Lindsay did not report a suicide plan. She did not report an intent to act. And she did not tell Gelada that she was having thoughts about harming her children. Gelada again recommended that Lindsay consider a partial hospitalization program. 2 days later, on December 15th, the concern escalated again. Gelada spoke with Lindsay and Patrick. Both reported that Lindsay was experiencing persistent suicidal thoughts. They discussed options that included Massachusetts General Hospital and McLean Hospital. That same day, Lindsay went to the emergency department at Massachusetts General Hospital for psychiatric evaluation. Patrick was becoming increasingly involved in Lindsay's care. Not as the person directing her medical treatment. He was her husband, helping her navigate an expanding network of psychiatrists, nurse practitioners, hospitals, and treatment programs. The MGH evaluation ultimately led toward another option, the perinatal day treatment program at Women and Infants Hospital in Providence, Rhode Island. But around this same period, Patrick was hearing something from Lindsay that her treating provider was not. Thoughts involving the children. Patrick testified during Lindsay's 2026 trial that on a couple of occasions in December, she told him she was having thoughts of hurting the kids or thoughts involving something terrible happening to them. He also described the thoughts as being more like fears that something bad might happen to the children. Patrick said Lindsay found those thoughts disturbing. He asked her directly whether she believed she needed to be kept away from the children. she said no. Patrick testified that Lindsay did not describe a plan to hurt them. She did not say she intended to act on the thoughts. And she did not describe a separate voice telling her what to do. Patrick remembered the situation as confusing. Lindsay could disclose a disturbing thought, and shortly afterward she might be making the children lunch, playing with them, getting them ready for bed, continuing to care for them. "I never saw Lindsay harm the kids," Patrick testified. This creates an important distinction in the evidence. What Lindsay told Patrick privately was not necessarily the same thing she told her clinicians. Rebecca Gelata testified that Lindsay never disclosed thoughts of harming the children to her. Both pieces of testimony can exist at the same time. Patrick says Lindsay told him. Gelata says Lindsay did not tell her. That distinction becomes significant when examining what Lindsay's providers knew and when they knew it. The nature of the thoughts themselves also matters. Patrick testified that Lindsay did not describe hearing a separate voice during these December episodes. Later, prosecution expert Dr. Kirk Heilbrunn testified about Lindsay's own descriptions of her symptoms. According to Heilbrunn, Lindsay described thoughts such as, "Your brain is damaged," and "You need to kill yourself." But Heilbrunn testified that Lindsay characterized those as her own thoughts: intrusive, unwelcome, disturbing, not an auditory hallucination coming from an outside voice. That becomes important because Lindsay would later describe something different when recounting January 24th. For now, the December evidence establishes something narrower. Lindsay was experiencing thoughts she found disturbing. Some involved suicide. Patrick says some involved the children. But neither Patrick's testimony nor Gelata's contemporaneous records document Lindsay describing a command voice at this stage. Patrick also testified that he did not believe Lindsay intended to harm the children. He had never seen her hurt them. She told him she did not believe she needed to be separated from them, and Patrick testified that no clinician instructed him that Lindsay could not safely be alone with the children. His judgment should be understood from the information available to him at the time, not reconstructed through hindsight. As Lindsay's condition continued, members of both sides of the family became more involved in helping. Her parents spent time at the house. Patrick's family also helped. The family was increasingly supporting both Lindsay and the daily demands of caring for 3 young children while she continued trying to obtain treatment. Then came December 20th. Patrick drove Lindsay to Women and Infants Hospital in Rhode Island. She entered its perinatal day treatment program. After dropping her off, Patrick left with Dawson. Later that day, Lindsay contacted him. She said the treatment team wanted him to return and speak with them. Patrick went back. He testified that the clinicians concluded their particular program wasn't the right fit for Lindsay. That finding should not be stretched beyond what it establishes. It did not mean nothing was wrong with her. It did not mean she no longer needed psychiatric treatment, and it did not resolve whether her condition was postpartum depression, another mood disorder, or something else. It meant the Women and Infants program did not believe its particular treatment setting was appropriate for her presentation. Lindsay also communicated with Gelata that day. She reported that Women and Infants had recommended she come off Seroquel. Gelata was concerned because Seroquel had appeared to help Lindsay sleep. But Lindsay also believed the medication was contributing to her depression and numbness. Gelata told her that if she wanted to discontinue it, she should taper rather than stop abruptly. On December 21st, Lindsay contacted Gelata again. She told her that Women and Infants had recommended a more general partial hospitalization program. One example was a program available through McLean Hospital. Gelata provided instructions for tapering Seroquel and sent Lindsay information about behavioral therapy resources. Gelata later testified, "I believe that was my last contact with Lindsay." During the period she treated Lindsay, Gelata said Lindsay consistently demonstrated clear and linear thinking. She was able to advocate for herself. Gelata never observed psychosis or mania, and Lindsay never told her that she had a plan to kill herself or a plan to harm her children. That does not erase Patrick's testimony. It demonstrates how different pieces of the same psychiatric history were being reported to different people. By late December, the record contained evidence that did not fit neatly into a single explanation. Lindsay was experiencing persistent suicidal thoughts, severe depression, intrusive thoughts, emotional numbness, and continuing psychiatric distress. Patrick says she had privately disclosed disturbing thoughts involving the children, yet she denied having a plan. Her providers continued documenting organized thinking. Gelada observed no psychosis. Patrick had never seen her harm the children, and Lindsay continued participating in their daily care. Now, a specialized perinatal program had concluded that its particular treatment model was not the appropriate setting for her. None of those facts cancels out the others. They describe the difficulty clinicians and family members were confronting in real time. Lindsay was clearly asking for more help, but there was still no settled explanation for everything she was experiencing. By December 20th, she had moved beyond ordinary outpatient psychiatric care. She had been evaluated in the emergency department at Massachusetts General Hospital. She had entered a specialized perinatal day program, and she had left it with a recommendation to pursue a different form of intensive psychiatric treatment. The thoughts of suicide had not simply disappeared. Patrick had heard disturbing thoughts involving the children, and Lindsay was still searching for a treatment that would make her feel better. The next option was one of the best-known psychiatric hospitals in the country, McLean. At around 4 a.m. on January 1, 2023, Lindsay Clancy voluntarily admitted herself to McLean Hospital, entering an inpatient psychiatric unit. This was not a court-ordered commitment. She chose to go. Prosecution expert Dr. Kirk Heilbrunn later testified plainly about what brought her there. What got her there was suicidal thinking. Dr. Aaliyah Goodhart, the McLean psychiatrist who would ultimately sign Lindsay's discharge summary, later testified extensively about the hospitalization at Lindsay's 2026 trial. McLean's records described a patient struggling with recent suicidal thoughts, severe sleep problems, anxiety, depression, and emotional numbness, along with significant concern about the psychiatric medications she was taking. Lindsay believed some of those medications were contributing to how disconnected and numb she felt. She arrived taking Seroquel and Valium. The central question here is not simply what medication she was taking. It is what psychiatric professionals observed during several days of inpatient care. At admission, McLean's records noted a recent history of thoughts about wanting to be dead. But during the assessment itself, Lindsay denied having a current plan to kill herself. She denied current homicidal thoughts, and the records presented at trial did not document psychosis. Goodhart testified that Lindsay was considered a low or minimal safety risk. That was an assessment of how she presented during that hospitalization. It was not a prediction of what she might experience weeks later. On January 1st, Lindsay was evaluated by psychiatrists other than Goodhart. Goodhart testified that Lindsay met with 2 psychiatrists that first day. The records described Lindsay as feeling numb, concerned about her medications, and denying current suicidal thoughts. The treatment plan included reducing Seroquel and observing Lindsay's sleep, mood, and symptoms. That chronology corrects one allegation that later appeared in civil litigation. Lindsay was not left for several days without seeing a psychiatrist. Trial testimony establishes that psychiatrists evaluated her on January 1st and again on January 2nd. Goodhart personally first met Lindsay on January 3rd. On January 2nd, another McLean psychiatrist evaluated her. Lindsay reported sleeping well on the reduced Seroquel dose. She denied suicidal ideation. She denied homicidal ideation. The plan remained to continue lowering the Seroquel and monitor what happened. Lindsay also interacted repeatedly with nurses and other staff and participated in programming on the unit. Goodhart's own evaluation came on January 3rd. She later described Lindsay as appropriately dressed, polite, cooperative, Her speech was normal in rate and volume. Her thinking was linear and goal-oriented. Her mood appeared anxious. Her affect was consistent with that mood. Lindsay repeatedly used one word to describe how she felt: numbness. She was particularly worried that she had become dependent on Seroquel simply to be able to sleep. Goodhart testified that she observed no signs of psychosis during that evaluation. During the same assessment, Lindsay acknowledged that she had experienced suicidal thoughts previously, but she denied having a current plan. Goodhart testified that Lindsay identified reasons she would not act on those thoughts: her children, her family, her mother. Clinicians refer to factors like these when assessing current suicide risk. They are not guarantees against what someone may experience later. Another part of Goodhart's testimony is especially important. Lindsay never told the McLean treatment team that she was having thoughts about harming another person. McLean's records did not document Lindsay reporting thoughts of killing her children, a plan involving the children, or a command voice involving them. That creates a significant difference between what McLean knew and what Patrick later testified he had heard privately in December. Patrick said Lindsay had told him about disturbing thoughts involving the children. That information was not reflected in the McLean record. There is no basis here to conclude Lindsay deliberately concealed it. The evidence establishes only what she did and did not disclose to the treatment team. Goodhart also testified that McLean knew another provider had considered the possibility of bipolar disorder. The team monitored Lindsay for symptoms that might support that possibility. Sleep was one factor. Goodhart explained that severe sleep deprivation can be relevant when evaluating hypomania and bipolar spectrum illness. But during Lindsay's hospitalization, clinicians did not observe mania, hypomania, or psychosis. That does not mean McLean permanently ruled out every bipolar spectrum condition. It establishes what clinicians observed during this admission. Goodhart ultimately diagnosed insomnia associated with a mental health condition. Lindsay's records also reflected an existing diagnosis of major depressive disorder. Goodhart considered postpartum factors as potentially relevant, but she testified that after her initial evaluation, she did not have enough information to make a more specific diagnosis beyond the clinical picture she was observing. Treatment continued. McLean reduced Seroquel. Goodhart switched Lindsay from Valium to Ativan. She also discussed other antidepressant possibilities, including Cymbalta. Goodhart testified that Lindsay's reported numbness could potentially have been associated with medication. Potentially. The hospitalization did not establish that medication was the definitive cause. Then came an important limitation in McLean's assessment. During cross-examination, Goodhart acknowledged that the hospital did not obtain the complete records from Lindsay's previous outpatient psychiatric providers. The McLean team did not speak with Dr. Jennifer Tufts or Rebecca Gelata about Lindsay's treatment history. No one asked Lindsay to sign a release so those complete records could be obtained. A McLean social worker did contact Patrick. Patrick expressed dissatisfaction with aspects of Lindsay's earlier psychiatric care, but Goodhart testified that McLean conducted no additional collateral contact beyond Patrick. That does not mean McLean assessed Lindsay without information. The hospital conducted its own full psychiatric evaluation. Clinicians reviewed Lindsay's chief complaint, medication history, family and psychiatric history, admission records. They observed her directly. Nurses, psychiatrists, social workers, and mental health staff interacted with her over several days. Patrick provided collateral information. But McLean did not have the complete longitudinal outpatient record that would later be assembled and examined at trial. That limitation became important to both sides. For prosecutors, McLean provided something unusually valuable: several days of direct inpatient psychiatric observation. Multiple professionals interacted with Lindsay. They documented organized thinking, no psychosis, no mania, improving sleep, and repeated denials of current suicidal or homicidal intent. For the defense, the same hospitalization contained an important gap. The clinicians did not possess the complete history from Tufts and Gelata. They did not speak directly with those providers, and the information Patrick says Lindsay had privately disclosed about thoughts involving the children was not reflected in McLean's records. The hospitalization itself does not resolve which interpretation ultimately carries more weight. By January 4th, Lindsay was participating in discharge planning. Goodhart testified that Lindsay was able to arrange her own outpatient follow-up appointment. Lindsay also wanted to return home for a belated birthday celebration for Cora, whose birthday had been December 24th. That is evidence of future-oriented planning. It should not be transformed into proof that Lindsay was psychiatrically well. Lindsay told the treatment team that she felt comfortable managing at home. On the afternoon of January 5, 2023, McLean discharged her. The discharge was not against medical advice. The treatment team approved it. At discharge, Goodhart testified Lindsay denied current suicidal ideation. She denied having a suicide plan. She denied homicidal ideation. And she denied thoughts of harming other people. Goodhart testified that based on Lindsay's presentation that day, she had no concern about Lindsay's safety or risk to somebody else. McLean classified her as a low safety risk. Again, January 5th. That assessment belongs to that moment in time. At discharge, Goodhart prescribed approximately 14-day supplies of Ativan and Trazodone. Lindsay was also continuing the process of tapering Seroquel. She left with crisis information, community resources, instructions for continuing psychiatric treatment, and an outpatient follow-up appointment she had already arranged. What can fairly be said about these 5 days is this. Multiple clinicians observed Lindsay directly. They spoke with her, adjusted medications, monitored sleep, assessed her thinking, assessed her risk. They did not document psychosis. They did not document mania. And on January 5th, they did not believe she posed an immediate danger to herself or another person. At the same time, they were assessing Lindsay without the complete record of everything she had previously reported to other providers and to her husband. Both facts belong in the record. Neither one, by itself, explains what came next. On January 5th, Lindsay went home. The following morning, she returned to the psychiatrist who had first treated her in September. Whatever had brought Lindsay Clancy into McLean was not finished. The final 18 days. One day after McLean discharged her, Lindsay Clancy had a virtual appointment with Dr. Jennifer Tufts. She wasn't doing well, Tufts later testified. Lindsay described feeling depressed and numb and continued to attribute some of that feeling to the Seroquel she had been tapering. Tufts described her as still appearing quite depressed. Lindsay denied suicidal ideation. She denied homicidal ideation. Tufts documented her condition that day as deteriorating. At trial, Tufts explained that she used the term to mean Lindsay appeared worse than she had at the previous appointment. It did not mean psychotic deterioration. Tufts testified she observed no psychosis. In response, Tufts increased Lindsay's Trazodone to 150 milligrams to help with sleep and recommended continuing Ativan and melatonin. Despite documenting Lindsay as deteriorating, Tufts testified that she did not believe Lindsay represented an immediate danger to herself. The following day, January 7th, the family held Cora's belated birthday party. Patrick testified that Lindsay attended and had obtained supplies for the party herself. Jurors later saw video from the gathering. Around this period, Patrick said he was checking in with Lindsay every day about how she was feeling. He testified that she was not reporting suicidal thoughts to him, nor was she expressing thoughts about harming the children. On January 8th, the family went to the Museum of Science. Patrick testified that Lindsay interacted with the children at the exhibits. The family went to dinner afterward. Patrick described Lindsay around this period as seeming much better. That was Patrick's observation, not a psychiatric assessment. That same day, Lindsay's mother asked whether she had slept well. Lindsay replied, I actually did. On January 9th, Lindsay saw Tufts again. She reported that trazodone had been helpful for sleep. She still felt emotionally flat. She again denied suicidal ideation. She again denied homicidal ideation. Tufts and Lindsay discussed whether to try another antidepressant because Lindsay remained depressed after coming off Seroquel. Better sleep did not mean the depression had resolved. On January 10th, phone records showed Lindsay texting her mother. Her mother asked how she was doing. Lindsay said she was at the gym with the kids. Again, that establishes activity. It does not establish psychiatric condition. On January 11th, Lindsay emailed Tufts asking about ketamine therapy. Tufts testified that ketamine can be an option for treatment-resistant depression. She told Lindsay it could be a good option, but insurance coverage generally required patients to have tried several conventional antidepressants first. I didn't think we were at that point yet, Tufts testified. Tufts said Lindsay may have indicated that she was interested in something that could work more quickly. The exchange shows Lindsay was continuing to search for relief from depression. On January 12th, Lindsay's mother texted, "Still feeling a little better?" Lindsay replied, "A little bit." A later civil filing also quotes Lindsay around this period describing, "Still feeling a very low mood, no motivation, and just very depressed." The same filing quotes her saying, "This has been going on for months now, and I am getting desperate for something that would work quickly to get me out of this depressed state." Those statements come from the later civil record rather than the criminal trial testimony being used for most of this chapter. They are included with that limitation. The statements also do not necessarily contradict Lindsay telling her mother that she felt a little bit better. A small improvement and continuing severe depression can coexist. On January 13th, former sports club employee Kimberly Hardy saw Lindsay bring Cora and Dawson to the club's child care area. Lindsay was wearing workout clothes. Hardy testified that Lindsay always picked the children up on time. She said Lindsay seemed happy to be with her children. Hardy described Cora and Dawson as their usual selves. That is one witness's observation. It is not a psychiatric examination. On January 14th, Lindsay texted her mother, "Hanging in there and waiting for the day I wake up feeling like me." That same day, Patrick went to brunch with friends for approximately 2 hours. He testified that Lindsay encouraged him to go. She remained home with the children. Patrick reported no incident. His testimony establishes what happened. It should not be converted into a retrospective declaration that all possible risk had been ruled out. On January 15th, the family went to an indoor water park in Hyannis. Jurors later saw video from the outing. Patrick testified that Lindsay's demeanor seemed pretty good. He said she interacted with the children and was able to take Callan to another area of the pool by herself. Lindsay later texted her mother, "It was fun." She said Cora and Dawson enjoyed it. Again, recreation does not disprove serious mental illness. It establishes what Lindsay and the family were doing while she continued reporting depression to her psychiatrist. On January 16th, Lindsay saw Tufts again. Her mood was documented as depressed. Her affect was flat. Lindsay reported very low mood, no motivation, numbness, having to force herself out of bed, and difficulty feeling like herself. Her concentration remained intact. She also told Tufts that caring for Callan and bonding with him feels forced. That statement describes Lindsay's subjective experience of bonding while depressed. It does not establish that she did not love her son. Lindsay again denied suicidal ideation. She again denied homicidal ideation. Tufts testified she observed no psychosis. Tufts prescribed amitriptyline, another antidepressant, at the lowest dose. Lindsay also agreed to taper Valium. That same day, Patrick went skiing with Cora and another father and child. Lindsay remained home with Dawson and Callan. Patrick testified that there were no problems. He and Lindsay texted throughout the day. Less than 2 weeks after McLean, Lindsay was still functioning in many ordinary ways. And she was still receiving psychiatric treatment because her depression had not resolved. On January 17th, Kimberly Hardy again saw Lindsay bring Cora and Dawson to the sports club's childcare area. Hardy described the children as their usual selves. On January 18th, Lindsay's phone was used to search ketamine for suicidal ideation. The search is important. Its limits are equally important. A search term establishes what was typed. It does not establish current suicidal intent. It does not establish diagnosis, and it cannot tell us with certainty why the person using the phone searched it, but it belongs in the record. Lindsay had already asked Tufts about ketamine treatment 1 week earlier. Around this period, Lindsay also told her mother that she had recently started another medication. On January 19th, Lindsay's phone was used to search symptoms of postpartum psychosis and psychosis symptoms. Other phone forensics testimony showed searches concerning schizophrenia and hallucinations. The hallucination search occurred 5 days before the killings. These searches have become important evidence for both sides. The defense argues that they are consistent with Lindsay trying to understand symptoms or changes she was experiencing or feared she might be experiencing. The prosecution emphasizes a basic limitation. Searching a symptom does not prove that someone is actually experiencing it. The searches establish curiosity or concern. They cannot diagnose the person making them, and despite these searches, the contemporaneous treatment record still contains no report from Lindsay to her psychiatric providers that she was hearing an external voice. On January 20th, Lindsay's phone produced another cluster of searches. One was, "Can you treat a sociopath?" She also searched the term intrusive, and records showed searches concerning psychosis and benzodiazepine withdrawal. The sociopath search has attracted particular attention because of what happened 4 days later, but the search itself should not be made to say more than it says. It does not establish that Lindsay believed she was a sociopath. It does not establish why she searched the term, and it does not establish a plan involving her children. Approximately 10 minutes after the sociopath search, another psychosis-related search appeared. Across this broader period, Lindsay's search history also included repeated research involving medications, bipolar disorder, postpartum conditions, sleep, benzodiazepines, and psychiatric symptoms. The prosecution and defense interpret the search history differently. For prosecutors, some of it demonstrates that Lindsay was aware of disturbing psychiatric concepts shortly before the killings. For the defense, the broader pattern shows a woman persistently researching mental health symptoms, diagnoses, and treatments because she was trying to understand what was happening to her. The searches themselves cannot resolve that disagreement. Then came the weekend of January the 21st. Lindsay's parents came to Duxbury. Patrick testified that Lindsay appeared to be doing better during the visit. Phone records show Lindsay's mother continued communicating with her. On January 22nd, her mother texted, "Nice to see you doing better." When prosecutors later questioned Paula Musgrove about that message, she said it was intended partly as encouragement. "She was making every attempt to feel better," Musgrove testified. "As a mother, I was encouraging her." That evening, Lindsay and Patrick went to dinner at a friend's house with Cora and Dawson. Patrick described Lindsay as quieter that day, but he said she was able to interact with their friends. Again, the evidence does not require us to decide that Lindsay was either recovered or rapidly deteriorating. It establishes how she appeared to people around her during that weekend. The next morning was January 23rd, 1 day before the killings. Cora and Dawson went to school. Patrick testified that Lindsay picked them up that afternoon, and Lindsay had what would become her final psychiatric appointment before January 24th. It was another virtual visit with Dr. Jennifer Tufts. Tufts described Lindsay as depressed, flat, anxious, without motivation, and numb. Lindsay reported episodes of her heart racing. She said she still had to force herself to get out of bed and leave the house. At the same time, Tufts described Lindsay as appropriately dressed. Her speech was appropriate. Her thought process was appropriate. Tufts testified that she observed no signs of psychosis. Lindsay denied suicidal ideation. She denied homicidal ideation. At trial, Tufts was asked directly whether Lindsay told her she was going to kill herself or her children. "Absolutely not," Tufts answered. Tufts increased Lindsay's amitriptyline to 20 milligrams in an effort to help her sleep. She testified that Lindsay did not appear to be experiencing side effects from the medication at that appointment. Lindsay continued attributing some of her depressive symptoms to medications. Tufts considered Lindsay's insight poor in part because of that attribution. That was Tufts's clinical assessment. It should not be converted into a universal conclusion about Lindsay's judgment. Another fact from January 23rd later became central. Lindsay did not tell Tufts that she was hearing a male voice. She did not report command hallucinations. Tufts observed no psychosis. That is significant prosecution evidence, but it does not by itself establish what Lindsay could or could not have experienced the following day. The defense argues that Lindsay experienced an acute psychotic episode and command hallucination on January 24th. Later experts would disagree sharply about whether that account was genuine and what it meant for criminal responsibility. That dispute belongs later. Across these final 18 days, two realities continued running beside each other. Lindsay attended Cora's birthday party, went to the Museum of Science, went to the gym, brought Cora and Dawson to childcare, stayed home with the children while Patrick went to brunch, stayed home with Dawson and Callan while Patrick took Cora skiing, went to a water park, visited with her parents, went to dinner with friends, picked her children up from school, communicated normally with family. At the same time, she continued telling her psychiatrist that she was depressed, numb, unmotivated, struggling to bond, and still searching for treatment that would help. And in the final week before January 24th, her phone contained searches involving ketamine for suicidal ideation, postpartum psychosis, schizophrenia, hallucinations, sociopathy, intrusive thoughts, and benzodiazepine withdrawal. Neither set of evidence erases the other. Ordinary functioning does not prove the absence of severe psychiatric illness. Psychiatric searches do not prove the presence of psychosis. Patrick testified that after McLean, "I was hopeful," he said Lindsay, "seemed much better." He continued checking in with her about suicidal thoughts and thoughts involving the children. During this January period, he said she denied those concerns. That evidence explains what Patrick knew and observed at the time. It should not be turned into hindsight blame. Across Lindsay's January appointments, Tufts testified she did not observe psychosis. Lindsay repeatedly denied suicidal and homicidal ideation. At the same time, Tufts continued documenting significant depression and adjusting treatment. Both were true right through January 23rd. The day before her children died, Lindsay spoke to the psychiatrist who had been treating her since September. She was still depressed, still numb, still struggling to find something that would help, but she denied wanting to die. She denied wanting to harm another person. She reported no voices. Her thinking, as Tufts observed it, remained organized. Tufts adjusted one medication. Then the appointment ended. Less than 24 hours later, the central question in this case would no longer be whether Lindsay Clancy needed psychiatric treatment. It would be what happened during the short period when she was alone with her children. January 24th, minute by minute. On the morning of January the 24th, 2023, Lindsay Clancy took 5-year-old Cora to a medical appointment. Patrick testified they returned home at around 8:30 a.m. Lindsay texted him about the visit, expressing relief that Cora's urine test looked normal and that there did not appear to be a kidney problem. Patrick worked from his home office that day. Later that morning, Lindsay was outside with Cora and Dawson. They built a snowman. She sent photographs to Patrick and to her mother. Patrick sent Lindsay a picture of Dawson, who had dressed himself completely on his own. Lindsay sent back a photograph of Cora. Later that morning, Patrick texted her, "You're a good mama." Patrick testified that Lindsay appeared to be having one of her better days. He did not hear her report suicidal thoughts. He did not hear her express thoughts about harming the children. That was Patrick's observation, not a psychiatric assessment. The afternoon continued with ordinary family communication involving the children, food, and errands. Then, at approximately 4:13 p.m., Lindsay's phone used Apple Maps to plan a route from the family's home to 3V Restaurant in Plymouth. The application could display the estimated travel time. This became one of the prosecution's most important pieces of digital evidence. Prosecutors argue Lindsay checked the route because she wanted to know how long Patrick would be away from the house. That is an inference. The digital evidence establishes that the route was planned. It cannot independently establish why. At approximately 4:47 p.m., Lindsay's phone showed activity involving Children's Miralax X and CVS. She called a CVS pharmacy and asked about medication for Cora. The employee who spoke with her, Angela Krause, later testified that Lindsay was understandable and did not sound impaired. "It was a very normal interaction," Krause said. "That describes one brief telephone conversation. It does not establish Lindsay's overall psychiatric condition." At approximately 4:53 p.m., Lindsay texted Patrick, "Any chance you want to do takeout from 3V?" and explained that she had not cooked and it had been a long day. Patrick agreed. He later testified that the family had eaten at 3V before, but had not normally ordered takeout from there. Their usual takeout restaurants were closer to home. Prosecutors consider that relevant. The choice itself does not establish intent. Between approximately 5:06 and 5:10 p.m., Lindsay and Patrick exchanged messages about what they wanted to order. Lindsay chose a Mediterranean power bowl. Patrick chose a scallop and pork belly risotto. At approximately 5:10 p.m., Lindsay called 3V and placed the order. Restaurant employee Saria Shelgren later testified that she had no difficulty understanding Lindsay. Nothing about the call seemed unusual to her. Again, one witness's observation of one telephone conversation. At approximately 5:13 p.m., Lindsay's phone was being used to search for Pedialax. Shortly afterward, she texted Patrick information about a liquid stool softener for Cora. Patrick testified that Lindsay asked him to pick it up at CVS while he was already leaving to collect dinner. Around that time, Patrick left the house. According to his testimony, Dawson was sitting on the couch eating chicken nuggets when he left. That detail would later become important when Lindsay described the events inside the house. For now, it establishes Patrick's recollection of what he saw before walking out the door. Patrick drove first to CVS. His departure left Lindsay alone with Cora, Dawson, Callan. This was the period during which the children were killed. Digital forensics expert Ian Whiffen later testified that the final heart rate measurement transmitted from Lindsay's Apple Watch to her phone occurred at approximately 5:23 p.m. The reading was 57 beats per minute. Whiffen explained that a watch can stop transmitting health data for several reasons. It can be removed, powered off, lose battery power, or become disconnected. The data does not establish which happened, and it does not establish why. At approximately 5:32 p.m., surveillance showed Patrick entering CVS. The store did not have exactly what he had been asked to buy. At approximately 5:33 p.m., Patrick called Lindsay. She did not answer. During approximately the same 5-minute window, Apple Health data on Lindsay's phone recorded 2 separate stair-climbing events. One occurred around 5:33, the other around 5:38. Whiffen explained that Apple grouped the 2 events into one 5-minute period. That does not mean somebody spent 5 continuous minutes climbing 2 flights of stairs. The data indicates 2 changes in elevation recorded by the device. It cannot tell us exactly who carried the phone at every second, what room that person entered, what any child was doing, or what was happening during either movement. At approximately 5:34 p.m., Lindsay called Patrick back. The conversation lasted about 14 seconds. Patrick asked whether a substitute version of the children's medication would be acceptable. Lindsay said yes. Patrick later testified that she sounded as though she was in the middle of something, but she otherwise seemed coherent and understood why he was calling. Patrick guessed she might have been giving the children baths. That was his assumption. The evidence does not establish that a bath was occurring. During the period Patrick was away, Lindsay strangled all 3 children. They were later found in the basement. Exercise bands were recovered as physical evidence. The physical and digital evidence do not independently establish the precise order in which the 3 children were killed. That sequence comes largely from Lindsay's later accounts. Those accounts will be examined separately. After the killings, Lindsay went upstairs. Evidence at the scene established that she injured herself with a knife. Other evidence presented later at trial indicated that medication ingestion was also part of her attempt to die. The exact amount of medication and precise sequence cannot be reconstructed from the digital timeline alone. Lindsay then went through a second-story bedroom window. The fall caused devastating spinal injuries and left her paralyzed. While events were unfolding at the house, Patrick continued his errands. After leaving CVS, he drove to 3V. Surveillance showed him entering the restaurant at approximately 5:54 p.m. He collected the food and drove home. Patrick testified that the drive from 3V usually took approximately 10 to 12 minutes. Patrick returned home shortly before 6:09 p.m. He entered through the side door, took off his boots, placed the CVS and 3V bags on the kitchen island. Then he noticed the house was really quiet. Patrick called out. No one answered. He called toward the basement. Still no answer. At approximately 6:09 p.m., he called Lindsay's phone. She did not answer. Patrick began checking upstairs. The bedroom door was locked. He opened it. Inside, he saw evidence that something serious had happened. The bedroom window was open. There was evidence of Lindsay's self-injury. Her phone was later recovered from the bedroom. Patrick ran downstairs and outside. Behind the house, he found Lindsay lying on the ground. She was badly injured. Patrick attempted to call 911. He testified that he initially had difficulty getting the call to connect because of problems involving the phone moving between Wi-Fi and cellular service. Eventually, the call connected. Jurors heard the approximately 7-minute recording during the 2026 trial. Judge William Sullivan prohibited the recording itself from being publicly distributed. This account will follow the same restraint. Patrick initially called because Lindsay was injured. He asked what had happened. Patrick testified that Lindsay told him, "I tried to kill myself." He asked where the children were. According to Patrick, they're in the basement. She did not tell him at that moment that the children were injured or dead. First responders arrived within minutes. They began treating Lindsay outside. Patrick told them he needed to check on his children. He ran back into the house, then into the basement. There, Patrick found Cora, Dawson, and Callan. He removed the exercise bands and attempted to help them. Cora and Dawson could not be revived. They died that night. Callan was transported to a hospital. He died 3 days later, on January the 27th. By now, the external timeline can reconstruct much of January 24th with unusual precision. Lindsay took Cora to a medical appointment. She spent time with the children. Her phone planned a route to 3V. She contacted CVS. She ordered dinner. Patrick left for CVS and the restaurant. Lindsay remained alone with the children. Patrick attempted to call her. She called him back. Her phone registered 2 changes in elevation. While Patrick was away, Lindsay killed Cora, Dawson, and Callan. She then attempted to kill herself. Patrick returned. He found Lindsay outside, and then he found the children. But the precision stops there. The timeline cannot tell us why Lindsay used Apple Maps. It cannot establish why she chose 3V. It cannot determine when she decided to kill the children. It cannot independently establish the precise order in which they were killed. It cannot record what she was thinking. It cannot tell us whether she was psychotic. It cannot tell us whether she heard a voice. And it cannot tell us whether she understood what she was doing to be wrong. Prosecutors argue that the sequence demonstrates planning. They point to the Apple Maps route, the restaurant farther from home than the family's usual takeout choices, the additional CVS errand, the resulting period alone with all three children, and Lindsay's apparently coherent conversations immediately beforehand. The state argues these were deliberate decisions designed to create enough time for Lindsay to act. The defense reads the same timeline differently. It does not dispute that Lindsay arranged the errands. It does not dispute that she killed the children. But her attorneys argue that apparently organized behavior does not answer the legal question of criminal responsibility. They contend that after Patrick left, Lindsay experienced an acute psychotic episode. That claim requires a different kind of evidence. The timestamps can tell us when Apple Maps was used, when Patrick entered CVS, when his call went unanswered, when Lindsay called back, when her phone recorded stair movement, when Patrick reached 3V, and when he was back inside the house calling for his wife. They cannot record an internal experience. They cannot hear a hallucination, and they cannot establish whether one existed. Lindsay survived January 24th, and in the days, months, and eventually years afterward, she began describing what she says happened inside her mind during those minutes. Not every version was identical, and the differences would become some of the most contested evidence in her trial. What Lindsay said happened. Everything reconstructed so far has largely come from outside Lindsay Clancy. Timestamps, phone data, surveillance, physical evidence, and other people describing what they saw and heard. This chapter turns to a different kind of evidence. What Lindsay later said happened inside her mind and inside that house. That distinction matters. Lindsay has not testified at her trial. What exists are statements she made to Patrick, a hospital chaplain, psychologists, and psychiatrists, statements those people later described under oath. Those accounts are evidence. They are not automatically established fact simply because Lindsay said them. Some elements remained consistent. Others changed. On January 24th, when Patrick found Lindsay outside the house, he asked what happened. Patrick testified that she said, "I tried to kill myself." He asked where the children were. She answered, "They're in the basement." She did not describe a voice to Patrick at that moment. That omission should not be stretched beyond what it establishes. Lindsay had suffered catastrophic injuries. She was having difficulty speaking, and the 911 recording captured only limited sounds from her. The evidence establishes only that Patrick did not hear her describe a voice at the scene. The first early account presented at trial involving a male voice came from hospital chaplain Sheila Kavanaugh. Kavanaugh began visiting Lindsay at Brigham and Women's Hospital on January 25th. At first, Lindsay was intubated and unable to speak. Their first spoken conversation occurred on January 31st. Kavanaugh testified that Lindsay said, "I'm so glad that my children are safe." Kavanaugh responded in religious terms, telling Lindsay that the children were safe in heaven. Kavanaugh also testified that Lindsay described hearing a male voice, persistent. According to Kavanaugh, Lindsay said the voice told her that if she did not obey its command, neither she nor her children would be safe. That is Kavanaugh's recollection. There is an important limitation. The statement about the voice did not appear in Kavanaugh's formal chaplain notes. That does not establish that Kavanaugh invented it. She testified under oath that she remembered Lindsay describing it. But the absence from the contemporaneous written record belongs in the evidence. A second early account came several days later. Psychologist Dr. Paul Zeisel first evaluated Lindsay at the hospital on February 4th. Her defense attorney had obtained a court order allowing Zeisel access to her. Lindsay asked to call Patrick. She used Zeisel's phone. Patrick did not answer. She left him a voicemail. 2 days later, on February 6th, Zeisel returned. Lindsay again used his phone to call Patrick. This time, Patrick answered. Zeisel testified that he listened as Lindsay spoke with her husband. She told Patrick that she loved him. Then she described hearing a male voice. According to Ziesel, Lindsay said the voice told her she had no choice. She had to kill the children and then kill herself. Patrick remembered the wording somewhat differently. He testified that Lindsay said a man's voice told her that if she did not do it now, she would lose her chance. Patrick testified that before January 24th, Lindsay had never told him she was hearing a male voice. This February 6th conversation was the first such disclosure Patrick says he received. The circumstances of that call later became part of the investigation. State police considered whether Ziesel could have influenced Lindsay before she spoke to Patrick. At trial, however, Ziesel denied telling Lindsay to claim she heard voices. He denied telling her to lie, and testimony did not establish evidence that Ziesel coached her to create the account. By early February, then, at least 2 witnesses had heard Lindsay describe broadly similar elements: a male voice, a command, urgency, and a belief that something involving her children's safety depended on obeying it. Those witnesses establish what Lindsay told them. They cannot establish that the voice objectively existed. Over the following years, forensic psychiatrists and psychologists interviewed Lindsay directly. Their conclusions differed sharply. For this chapter, their value is narrower. What did Lindsay tell them? One of the earliest major forensic evaluations came from defense psychiatrist Dr. Philip Resnick. Resnick interviewed Lindsay for approximately 3 hours in May 2023, around 4 months after the killings. He also interviewed her parents and reviewed medical and investigative records. Resnick testified that Lindsay described what he considered a command hallucination. But according to him, Lindsay described more than simply hearing words. She said it felt as though an external force had taken control of her body. Resnick characterized her account as a delusion of influence. She felt that her body was taken over by an external force, he testified. He compared Lindsay's description to being a puppet with someone else, pulling the strings. Those are Resnick's clinical interpretations of what Lindsay told him. They are not independent proof that an external force controlled her. Resnick also testified that Lindsay described believing she needed to kill the children before killing herself. He would ultimately conclude that she had been psychotic. That conclusion belongs in the next chapter. Other forensic interviews produced another detail. Lindsay said she spoke to the children while killing them. Prosecution psychiatrists later testified that she reported saying, "Go to God," or "Go to God, baby." That statement became important because different experts interpreted it very differently. Some saw evidence of psychotic thinking. Others saw evidence of purposeful reasoning about death and what Lindsay believed would happen afterward. For now, the relevant fact is simply that Lindsay later reported saying it. She also eventually provided a specific order for the killings. According to forensic psychiatrist Dr. Gregory Sathoff, Lindsay told him Dawson first, then Cora, then Callan. Sathoff testified that Lindsay said she brought Dawson into the basement first. After killing him, she went back upstairs. She then brought Cora downstairs, and finally, Callan. The objective evidence discussed in Chapter 10 does not independently establish that exact order. This is Lindsay's later recollection. Sathoff interviewed Lindsay twice by video in May and June 2026. Together, the interviews lasted approximately 11 hours. They produced one of the most detailed versions of January 24th presented to the jury. According to Sathoff, Lindsay said the critical moment occurred after the approximately 5:34 p.m. telephone conversation with Patrick. She said she was near the refrigerator. She described getting chicken nuggets for the children. Then she heard the voice, male, external, clear, constant. According to Sathoff, Lindsay said it repeatedly told her words to the effect. This was her last chance. She had to kill the children, and then she had to kill herself. In the version Lindsay gave Sathoff, the voice began almost immediately after the phone call with Patrick. She said it continued constantly while she killed all 3 children, and then it stopped. According to her account, the voice ended after she killed Callan. Lindsay told evaluators she had never experienced that particular voice before. She said it never returned afterward. Prosecution experts later emphasized how unusual they considered that pattern. Defense experts concluded the voice was genuine. Those interpretations belong in separate chapters. But there was also a significant problem in Lindsay's reported timeline. Southhoff testified that Lindsay had previously given another evaluator a different time for when the voice began. In that account, the voice began at approximately 5:15 p.m. shortly after Patrick left the house. The version Lindsay gave Southhoff placed the beginning at approximately 5:34 p.m. after Patrick called from CVS. That is a difference of roughly 19 minutes. In an event compressed into a very short period of time, Southhoff considered the discrepancy important. The evidence establishes that the accounts differed. It does not establish why. Memory can change. Trauma can affect recollection. Years had passed between some of the interviews. Mental illness can affect memory, or inconsistencies can undermine the reliability of an account. Those are possible interpretations. The documentary cannot choose among them simply because the timestamps differ. There was another concrete discrepancy: chicken nuggets. Lindsay told Southhoff that she was near the refrigerator getting chicken nuggets for the children when the voice began. Patrick's testimony described something different. When Patrick left the house, he said Dawson was already sitting on the couch, eating chicken nuggets. Southhoff highlighted that conflict during testimony. The two accounts do not match. That does not automatically establish that Lindsay lied. It establishes that her later recollection conflicts with Patrick's recollection of what he saw before leaving the house. Against all of these later accounts sits another important baseline. Before January 24th, Lindsay's treating psychiatric providers did not document her describing an external male voice, auditory hallucinations, or command hallucinations, not Tufts, not Gelata, not the McLean clinicians. On January 23rd, one day before the killings, Lindsay did not tell Tufts she was hearing voices. Tufts observed no psychosis. That does not establish that a hallucination could not begin suddenly the following day. It establishes what had and had not been documented before January 24th. There is also an important distinction between the thoughts Lindsay described in December and the voice she later described on January 24th. In December, Lindsay described intrusive thoughts. Later testimony included examples such as, "Your brain is damaged and you need to kill yourself." According to testimony about her later interviews, Lindsay characterized those December experiences as her own thoughts. Unwanted, disturbing, but coming from herself. Her later description of January 24th was categorically different. A separate male voice, external to her, commanding her, persistent, and according to Lindsay, not under her control. Those two experiences should not be merged. After the children were dead, Lindsay later told evaluators she went upstairs. She obtained a knife. She injured herself. She took medication in an attempt to overdose. Then she went through the bedroom window. Southhoff testified that Lindsay described the overdose to him only vaguely. She told him she took pills. But he said she did not initially describe crushing them. Patrick separately told Southhoff that he found powdered medication in a wine tumbler. Southhoff testified that Lindsay said lemonade had been in the tumbler from the night before. Patrick told him lemonade was not something the family commonly kept in the house. Those details became relevant to the prosecution's argument about the sequencing and organization of Lindsay's actions, but they do not need to become a dramatic mystery of their own. Toxicology testing later confirmed several prescribed psychiatric medications were present in Lindsay's system. A toxicologist testified that the concentrations he measured were not at levels he considered toxic or consistent with a large medication overdose. That does not establish what Lindsay intended when she took the medication. It establishes what the laboratory found. Across interviews, Lindsay also described beliefs connecting the deaths with her own suicide, fear that the children would suffer without her, the children being safe, and an expectation that they would ultimately be together after death. Those beliefs became central to both sides, but they should not be turned into a simple narrator conclusion such as, "She killed them out of love." That is an interpretation. Forensic psychologist Dr. Kirk Heilbrunn later testified that Lindsay told him that during the killings, she was not thinking about the wrongfulness of what she was doing at all. That, too, is Lindsay's retrospective account. It is not the legal answer. Whether mental illness prevented Lindsay from appreciating wrongfulness or from conforming her behavior to the law is the central question the jury must decide. Looking across the accounts, a central story remained relatively consistent. Lindsay said she heard a male voice. She said the voice commanded her to kill the children and then herself. She killed the children. Then she attempted suicide. And in later descriptions, death became connected with ideas of safety and remaining together. But important details changed when the voice began. What Lindsay was doing when it started, some wording of the command, details surrounding the overdose, and other pieces of the sequence. There is no recording of the voice Lindsay describes. There is no forensic test that can reach backward into her mind during those minutes on January 24th. What exists is her account, an account she began giving in the days after the killings. An account with a consistent central claim. A male voice commanded her to kill her children and herself. And an account containing details that did not remain identical over time. The next question is not simply whether Lindsay said she experienced psychosis. It is what psychiatric experts concluded after reviewing the months of treatment records, her behavior before January 24th, the killings themselves, the suicide attempt, and Lindsay's later descriptions. The defense says that evidence points to psychosis and to a woman who was not criminally responsible for what she did. Was she psychotic? Massachusetts law asks a specific question when lack of criminal responsibility is raised. Did the defendant have a mental disease or defect that caused her to lack substantial capacity either to appreciate the criminality or wrongfulness of what she was doing, or to conform her conduct to the requirements of the law? And there is another important point. Lindsay Clancy does not have the burden of proving that she lacked criminal responsibility. Once the issue is properly raised, the Commonwealth must prove beyond a reasonable doubt that she was criminally responsible. The defense position is that the Commonwealth cannot do that. Their argument is that Lindsay was severely mentally ill, psychotic, and that because of that illness, she could not adequately appreciate the wrongfulness of killing her children, could not adequately control her conduct, or both. That is the defense case. The jury ultimately decides whether the Commonwealth has carried its burden. Dr. Paul Zeisel, a psychologist, began evaluating Lindsay shortly after the killings. He first saw her at Brigham and Women's Hospital on February 4, 2023. He continued meeting with her repeatedly afterward. Part of his role involved assessing Lindsay's mental condition and competence. He also administered psychological testing. Zeisel testified that the testing showed no evidence that Lindsay was malingering, deliberately fabricating, or grossly exaggerating psychiatric symptoms. He concluded that she suffered from serious mental illness. And at trial, Zeisel gave his opinion on the central legal question. He believed Lindsay did not appreciate the wrongfulness of killing her children. That is his expert opinion, not an established fact. Zeisel was also present for an important early disclosure. On February 6th, Lindsay used his phone to call Patrick. During that conversation, Patrick and Zeisel testified. Lindsay described hearing a male voice commanding her to kill the children and then herself. Zeisel denied suggesting that account to Lindsay. He denied coaching her. He denied telling her to lie. Investigators at one stage considered whether Zeisel might have influenced Lindsay's account, but the evidence presented at trial did not establish that he coached her to fabricate auditory hallucinations. That does not prove the voice was genuine. It addresses one possible explanation for why Lindsay began describing it after the killings. One principle runs through much of the defense psychiatric case. Psychosis does not necessarily appear continuously. A person can communicate coherently at one moment and experience psychotic symptoms at another. That is how defense experts respond to a large part of the prosecution's evidence from January 24th. Lindsay took Cora to the doctor, built a snowman, communicated normally with Patrick, called CVS, ordered dinner, used her phone, returned Patrick's call. None of those things, defense experts argue, automatically rules out an acute psychotic episode later that afternoon. The defense's central forensic psychiatrist was Dr. Philip Resnick. Resnick has spent decades evaluating psychosis, criminal responsibility, and cases in which parents kill their children. He has participated in numerous high-profile criminal cases, including the Andrea Yates case. That establishes his experience. It does not make the Yates case evidence about Lindsay Clancy. Resnick evaluated Lindsay approximately 4 months after the killings. In May 2023, he interviewed her for roughly 3 hours. He also interviewed Lindsay's parents, and he reviewed medical records and investigative materials. Resnick described Lindsay as cooperative. She gave him a detailed account. He characterized her affect during the interview as flat or blunted. At the same time, nurses told him Lindsay cried regularly about the deaths of her children. Neither observation is a test of guilt, innocence, or sincerity. They are clinical observations. Resnick ultimately diagnosed Lindsay with bipolar II disorder with severe depression. He believed the illness had been developing before January 24th, but his conclusion about the day of the killings went further. Ms. Clancy was frankly psychotic, Resnick testified. He said that because of the timing relative to Callan's birth and the psychosis he believed existed on January 24th, he would characterize the episode as postpartum psychosis. That diagnosis came after the killings. No treating clinician had diagnosed Lindsay with postpartum psychosis before January 24th. Resnick acknowledged that psychosis occurring approximately 8 months after childbirth was relatively unusual. He nevertheless believed the illness Lindsay had developed after Callan's birth ultimately culminated in psychosis. At the center of that conclusion was the male voice. Resnick accepted Lindsay's account as a genuine, command hallucination. According to Lindsay's later description, the voice commanded her to kill the children and then herself. But Resnick did not base his opinion solely on that statement. He placed the voice within a broader history. Months of severe depression, profound insomnia, repeated psychiatric treatment, intrusive thoughts, suicidal thinking, thoughts involving the children reported to Patrick, possible bipolar spectrum symptoms, multiple medication changes, an inpatient psychiatric admission, and continued serious depression after discharge. In Resnick's interpretation, the command voice represented the culmination of a larger psychiatric deterioration. He also identified another phenomenon, a delusion of influence. Resnick testified that Lindsay described feeling that her body had been taken over by an external force. He compared her description to being a puppet while someone else was pulling the strings. That analogy matters to the defense because it goes beyond hearing a command. Resnick believed Lindsay experienced the psychosis as interfering with her own sense of control. In his opinion, she felt compelled to obey. That directly addresses one part of the Massachusetts legal standard, whether mental disease deprived Lindsay of substantial capacity to conform her conduct to the law. Then there is what Lindsay later reported saying to the children, "Go to God," or "Go to God, baby." Different experts interpreted those words differently. Resnick believed they fit a distorted belief in which Lindsay thought killing the children could somehow protect them. He classified the killings as fitting what researchers of parental homicide call altruistic filicide. That is a descriptive classification. It is not a psychiatric diagnosis. In that classification, a parent kills a child while believing, rationally or irrationally, that death is somehow in the child's interest. Resnick believed Lindsay thought that if she killed herself, her children would be left in an unbearable situation without her. Under his interpretation, taking them with her to death became, through psychotic thinking, morally justified. That is Resnick's opinion about Lindsay's mental state. It should not be rewritten as she killed them out of love. The distinction matters. A central defense argument is that a psychotic belief does not need to make logical sense to an outside observer. Kill the children. Kill herself. The children go to heaven. They remain safe. An external force controls her body. To a person without that psychosis, the logic may appear irrational. Resnick's point is that its irrationality does not make it incapable of controlling the thinking of someone who is psychotic. In his view, Lindsay believed what she was doing was morally right. That goes directly to the legal question of wrongfulness. The defense also has to confront evidence that looks organized. Apple Maps, 3VCVS, Patrick leaving the house. The killings occurring one child after another. The later suicide attempt. Prosecutors see planning. The defense experts respond that organized behavior does not necessarily eliminate psychosis. A person experiencing psychosis may still be capable of using a phone, placing a restaurant order, following familiar routines, moving through a house, and completing sequential actions. That is their interpretation of the evidence. It does not establish that every organized person can simultaneously be psychotic. It explains why the defense experts do not believe Lindsay's apparently organized behavior answers the psychiatric question by itself. Then there is perhaps the defense's most difficult fact. Before January 24th, no treating clinician documented psychosis. Not Tufts, not Gelada, not McLean. No treating provider documented an external male voice. And on January 23rd, Tufts saw no signs of psychosis. Resnick does not dispute that history. His explanation is that Lindsay was not psychotic continuously. Psychosis can indeed wax and wane, he testified. In his view, Lindsay was not frankly psychotic during the entire day of January 24th. She could take Cora to an appointment, interact with the children, build a snowman, then experience an acute psychotic episode later. Resnick also suggested Lindsay may have minimized psychiatric symptoms because she feared that more severe disclosures could result in losing access to her children. That is Resnick's interpretation. The evidence does not independently establish that Lindsay deliberately concealed psychosis from her doctors. Another challenge is the unusual course of the voice Lindsay described. It appeared on January the 24th. She said she had never heard it before. It remained constant during the killings. It stopped after Callan died, and it never returned. Resnick accepted that account as a genuine hallucination despite the unusual pattern. His opinion was that psychosis can fluctuate, and that a person does not need a long history of chronic auditory hallucinations to experience an acute psychotic episode. The prosecution's experts strongly disagree. That disagreement belongs in the next chapter. The defense also presented evidence aimed at the possibility that Lindsay fabricated psychiatric symptoms after the killings. Zeisel testified that psychological testing did not indicate malingering. He found no evidence that Lindsay was deliberately faking her psychiatric presentation. Resnick similarly testified that Lindsay appeared more likely to minimize symptoms than exaggerate them. Those findings matter, but they have limits. A psychological test cannot certify every memory or every statement someone makes as factually true. The evidence supports saying the testing did not indicate symptom fabrication. It does not support saying the testing proved every part of Lindsay's account was true. Another defense psychiatrist focused on the care Lindsay received before January 24th. Dr. Donald Conde did not personally evaluate or treat Lindsay. He reviewed her medical records. Conde described portions of Dr. Tufts' records as somewhat sparse. He noted that they contained many checkboxes but comparatively little narrative detail explaining what occurred during sessions. He also criticized the absence of certain medical testing. Conde testified that neither Tufts nor Gelada had ordered blood testing that could have examined possible physical contributors to psychiatric symptoms, including thyroid or hormonal abnormalities. His testimony supports the defense argument that Lindsay's psychiatric condition may not have been evaluated as completely as it could have been. It does not establish that a blood test would have prevented what happened. It does not establish that her clinicians caused the killings, and Conde was not an eyewitness to Lindsay's condition during treatment. The medication history also remains part of the defense case. Lindsay received more than 30 prescriptions involving 13 psychiatric medications over several months. As established earlier, that does not mean she took 13 psychiatric medications simultaneously. Some were brief trials, some replaced others, some were barely taken. The defense argues that antidepressant exposure, possible bipolar illness, severe insomnia, and repeated medication changes are relevant to understanding why Lindsay's condition worsened. That is different from proving that medication caused the killings. The postpartum component is also disputed. Callan was approximately 8 months old. Defense experts testified that postpartum psychiatric illness can continue or emerge beyond the first weeks following childbirth. Resnick linked Lindsay's deterioration after Callan's birth with the psychosis he believed existed January 24th. Again, that is his clinical opinion. 8 months after childbirth does not automatically make any psychiatric illness postpartum psychosis. Taken together, the defense case is broader than a single alleged voice. It includes months of documented psychiatric deterioration, profound insomnia, repeated requests for help, suicidal thoughts, intrusive thoughts, disturbing thoughts involving the children reported to Patrick, possible bipolar spectrum symptoms, inpatient psychiatric hospitalization, continued severe depression after McLean, psychiatric searches immediately before January 24th, a serious suicide attempt immediately after the killings, an early post-event account of a male command voice, and experts who concluded Lindsay was psychotic. That is the cumulative defense argument. But the limitations remain. No treating clinician documented psychosis before January 24th. No treating clinician documented auditory hallucinations. McLean observed no psychosis during several days of inpatient care. Tufts observed none the day before the killings, and Lindsay's later accounts contain discrepancies concerning when the voice began and what she was doing when it started. Resnick and Zeisel do not erase those facts. They argue those facts do not overcome their conclusions. Zeisel concluded Lindsay lacked substantial capacity to appreciate the wrongfulness of killing her children. Resnick concluded she was psychotic, that she experienced a command hallucination, that she experienced a delusion of influence, and that because of her mental illness, she was unable to conform her conduct to the requirements of the law. Those opinions support the defense claim that Lindsay lacked criminal responsibility. But Lindsay does not have to prove that conclusion beyond a reasonable doubt. The Commonwealth carries the ultimate burden of proving criminal responsibility, and prosecutors called their own psychiatric experts to do exactly that. Those experts reviewed many of the same records. Some interviewed the same woman, and they reached almost the opposite conclusion. They agree Lindsay was seriously mentally ill. Where they disagree is what that illness did, and did not, prevent her from understanding and controlling on January 24th. The state says no. Under Massachusetts law, once lack of criminal responsibility is properly an issue, Lindsay Clancy does not have to prove that she lacked criminal responsibility. The Commonwealth bears the burden. It must prove beyond a reasonable doubt that Lindsay was criminally responsible when she killed her children. A person lacks criminal responsibility if, because of a mental disease or defect, she lacked substantial capacity either to appreciate the criminality or wrongfulness of her conduct or to conform her conduct to the requirements of the law. Critically, the Commonwealth does not have to prove Lindsay was mentally healthy. It can acknowledge serious mental illness and still meet its burden if the jury concludes that, despite that illness, Lindsay retained substantial capacity to understand the wrongfulness of what she was doing and to control her conduct. That is the prosecution's psychiatric case. Dr. Avram Mack, a psychiatrist retained by the Commonwealth, interviewed Lindsay at Tewksbury Hospital on 2 occasions in April 2026. His second session lasted approximately 3 hours. Mack testified that he saw no evidence Lindsay was malingering. He concluded Lindsay had suffered from a major depressive episode in late 2022 and January 2023, likely as part of major depressive disorder. He also considered anxiety relevant to her psychiatric presentation. Mack did not deny that Lindsay was genuinely suffering. His opinion was not that nothing was wrong with her. His disagreement with the defense concerned what illness she had and what that illness did to her capacity on January 24th. Mack found no evidence of mania or hypomania in the treatment record. For that reason, he rejected the bipolar II diagnosis accepted by several other experts. That puts Mack at odds not only with the defense, it puts him at odds with 2 of the Commonwealth's other experts, Kirk Heilbrunn and Gregory Satoff. Both concluded Lindsay did have bipolar II disorder. That disagreement should not be smoothed over. These experts reached similar legal conclusions through different diagnostic paths. On psychosis, Mack found no evidence of it in Lindsay's pre-killing treatment record. He pointed to the pattern already established. Treating providers repeatedly documented organized thinking. McLean clinicians observed no psychosis. Tufts observed none as recently as January 23rd, and Lindsay had never reported auditory hallucinations before the killings. Mack also distinguished severe psychiatric symptoms from psychosis. A delusion, he explained, involves a fixed false belief resistant to correction. Someone can be deeply depressed, suicidal, anxious, fixated, wrong about something, or excessively frightened by something real. None of those conditions automatically establishes psychosis. Mack concluded that Lindsay suffered from a mental disease, but in his opinion, she still retained substantial capacity to appreciate the wrongfulness of killing her children, and she retained substantial capacity to control her conduct. He therefore concluded that she was criminally responsible. Mack also interpreted one of Lindsay's reported statements differently from defense psychiatrist Philip Resnick, "Go to God," or "Go to God, baby." Resnick interpreted those words as part of psychotically distorted thinking. Mack saw something else. He interpreted the statement as evidence that Lindsay understood the children were alive. What she was doing would cause their deaths, and that death carried meaning. That is Mack's interpretation. The words themselves do not independently prove either expert right. The defense challenged Mack aggressively. His experience with postpartum psychosis was limited compared with some of the defense experts. His experience conducting criminal responsibility evaluations was also questioned, and defense counsel challenged aspects of his methodology. Those criticisms concern how much weight the jury should give Mack's opinion. They do not erase it. The Commonwealth then called Dr. Kirk Heilbrunn. Heilbrunn is a forensic psychologist. He interviewed Lindsay over several days in April 2026. He separately interviewed Patrick and Patrick's mother, Susan, and he reviewed a large body of treatment, investigative and forensic material. Heilbrunn testified that forensic evaluators have to guard against retention bias and confirmation bias. That describes the method he says he used. It does not guarantee the correctness of his conclusion. Unlike Mack, Heilbrunn diagnosed Lindsay with bipolar II disorder. He therefore agreed that Lindsay suffered from a mental disease or defect. He also recognized severe depression, hopelessness, insomnia, suicidal thinking, and difficult experiences surrounding psychiatric medications. Again, the Commonwealth psychiatric case is not that Lindsay was well. Heilbrunn's conclusion was that her illness did not destroy her criminal responsibility. He did not believe Lindsay was experiencing acute psychosis during the killings, and he directly questioned her later account of the command hallucination. Lindsay said she had never heard the voice before January 24th. It appeared suddenly. It remained constant. It repeated essentially the same command. It lasted only during the killings. It stopped when Callan died. And it never returned. Heilbrunn called that pattern very, very unusual. He went further. He testified that in his assessment the evidence suggested the hallucination Lindsay later described may have been exaggerated or fabricated. That is a serious prosecution opinion. It is not a fact established simply because Heilbrunn said it. No expert can directly observe what Lindsay experienced inside her mind that afternoon. Heilbrunn instead offered a different explanation for the killings. He believed Lindsay was profoundly depressed, hopeless, suicidal, and preparing to make a serious attempt to die. In his interpretation, Lindsay killed the children because she believed that if she died, they would suffer without her. He characterized what happened as suicide combined with altruistic filicide. That is the same general filicide category Resnick invoked, but their psychiatric interpretations are very different. Resnick believed Lindsay's altruistic thinking was psychotically distorted and part of a loss of criminal responsibility. Heilbrunn believed severe depression and hopelessness influenced Lindsay's reasoning, while she still retained meaningful awareness and control. He testified she retained an awareness of the illegality of killing others, including her children. He also concluded that Lindsay retained moral awareness that killing them was wrong. Her mental illness influenced that awareness, he said. It did not eliminate it. That distinction is central to the prosecution's case. Mental illness influenced motive. In Heilbrunn's opinion, it did not destroy substantial capacity. Heilbrunn also focused on control. The killings required repeated decisions. Why the basement? Which child first? How to get each child downstairs? What to say to them? How to kill them? What to do afterward? Heilbrunn interpreted those decisions as evidence that Lindsay was not simply acting without agency. Again, decision-making does not automatically prove criminal responsibility. This is how Heilbrunn interpreted the sequence. He also offered an alternative explanation for Lindsay's later descriptions of feeling unreal, detached, or as though she were watching herself act. Peritraumatic dissociation. A person experiencing overwhelming trauma, Heilbrunn explained, can feel disconnected from what is happening. The event may seem unreal. The person may feel as though they are observing themselves from outside. Heilbrunn considered that explanation more plausible than psychosis for some of Lindsay's reported experience. That is his clinical interpretation, not a diagnosis this documentary can make. Heilbrunn also questioned whether what Lindsay later characterized as an external male voice could have been closer to the intrusive thoughts she had previously experienced. In December, Lindsay described thoughts she understood as her own: unwanted, disturbing, intrusive. The January account is different. She later described a male voice outside her head. Heilbrunn questioned whether that distinction was reliable. He could not independently verify what Lindsay experienced. Then came the Commonwealth's final psychiatric expert, Dr. Gregory Saathoff. Saathoff is a forensic psychiatrist affiliated with the University of Virginia and serves as a senior psychiatrist with the FBI Behavioral Analysis Unit. He testified here as a psychiatrist evaluating criminal responsibility, not as a criminal profiler deciding guilt. Sathoff interviewed Lindsay twice by video, in May 2026 and June 2026. The interviews lasted approximately 11 hours combined. He also reviewed a substantial body of material: medical records, police records, grand jury material, expert reports, videos, digital evidence, and other investigative records. Sathoff diagnosed Lindsay with bipolar II disorder. He acknowledged depression, anxiety, suicidal ideation, intrusive thoughts, sleep disruption, and difficult medication experiences. He did not deny that Lindsay was seriously mentally ill. He nevertheless concluded she was criminally responsible. In his opinion, Lindsay retained the ability to distinguish right from wrong, and she retained control over her conduct. Much of Sathoff's skepticism centered on the male voice. He testified that he had treated thousands of people experiencing psychosis. Lindsay's account did not resemble what he typically saw. First, no previous voice. Before January 24th, Lindsay had never reported auditory hallucinations. Second, one occurrence. She said she heard this voice only during the killings, never before, never afterward. Third, the voice was constant. Lindsay described it repeating essentially the same command continuously. Sathoff testified that hallucinations he had encountered clinically were generally not experienced that way. Fourth, the voice stopped when Callan died. Committing the act is not curative of the voice, Sathoff testified. I've not ever seen that. That is a statement about his clinical experience. It does not prove that such a pattern is impossible, but it contributed to his conclusion that Lindsay's account was not convincing. He also considered it unusual that Lindsay described an isolated auditory hallucination without the broader delusional picture he would expect to accompany acute psychosis. Then there were the inconsistencies. Lindsay gave different accounts of when the voice began: approximately 5:15 p.m. in one version, approximately 5:34 p.m. in another. She told Sathoff that she was near the refrigerator getting chicken nuggets for the children when the voice began. Patrick testified that when he left the house, Dawson was already sitting on the couch eating chicken nuggets. Crime scene evidence became relevant to that discrepancy as well. Sathoff called inconsistencies like these cause for significant concern. His conclusion was not that the discrepancies mathematically proved Lindsay lied. He believed they reduced the reliability of her later account. Sathoff also directly challenged Resnick's description of Lindsay as being like a puppet. According to Lindsay, the voice told her, "Kill the children and then kill yourself." But Sathoff emphasized everything the alleged voice did not specify. It did not tell Lindsay which child to kill first, to use the basement, to use exercise bands, how to get each child downstairs, how to kill each child, or how to attempt her own death. Those decisions, Sathoff testified, were Lindsay's. In his assessment, that demonstrated control over method and sequence. The defense has an obvious response. A genuine command hallucination does not necessarily need to dictate every physical step before it can influence behavior. That dispute cannot be resolved simply by listing the choices. Sathoff also testified that people experiencing genuine command hallucinations do not automatically obey them. Some resist, some do not. For that reason, he rejected the proposition that even a genuine command necessarily proves a person lacks substantial capacity to conform conduct to the law. That is different from saying hallucinations can always be resisted. His point was that the presence of a command does not answer the legal control question by itself. Sathoff also placed considerable weight on January 24th itself. Lindsay drove Cora to a medical appointment, interacted with the children, built a snowman, communicated with Patrick, used Apple Maps, called CVS, ordered dinner, returned Patrick's call. and according to the later account of the killings, carried out a sequence of actions involving each child individually before attempting suicide. Sathoff described the day as one of significant control. Throughout the day, she was methodical and quite controlled and organized, he testified. He also considered the approximately 5:34 p.m. callback significant. Lindsay returned Patrick's call from CVS. She answered his question about the medication. She did not express distress. Sathoff testified that by calling Patrick back and resolving the question, Lindsay helped ensure he would continue the errands rather than return immediately. That is Sathoff's interpretation of the call. It is not something the call recording itself can establish about her motive. In Sathoff's view, the day required substantial decision-making, not only killing the children, but planning, sequencing, responding to an interruption, continuing after that interruption, then turning to her own suicide attempt. It is my opinion, Sathoff testified, that Lindsay Clancy was criminally responsible. The prosecution experts also considered Lindsay's immediate statement after the killings. Patrick asked what happened. Lindsay said, "I tried to kill myself." Heilbrunn considered that relevant. His interpretation was that Lindsay immediately understood and could accurately describe what she had attempted to do to herself. He questioned why, if acute psychosis dominated the event, she did not initially explain what happened through the psychotic framework she later described. That is Heilbrunn's interpretation. It is not a universal rule about how someone experiencing psychosis must speak after an event. Taken together, the Commonwealth psychiatric case is not. Lindsay had no mental illness. The case is Lindsay had serious mental illness. But months of psychiatric providers observed no psychosis. McLean observed none during several days of inpatient care. Tufts observed none January 23rd. Lindsay never reported an external voice beforehand. The voice she later described followed a pattern the prosecution experts considered clinically atypical. Her later accounts contained important inconsistencies. Her behavior required multiple sequential choices, and the prosecution experts concluded that despite mental illness, Lindsay retained meaningful awareness and control. That is how the Commonwealth attempts to meet its burden of proving criminal responsibility beyond a reasonable doubt. Even the Commonwealth's experts do not completely agree with one another. MAC, major depressive disorder, no bipolar diagnosis. Heilbrunn, bipolar II disorder, no acute psychosis. Sathoff, bipolar II disorder, no command-driven psychosis. All three nevertheless concluded Lindsay was criminally responsible. That disagreement matters. Psychiatric diagnosis and legal responsibility are related questions. They are not identical questions. The defense challenged each expert. Heilbrunn acknowledged that postpartum psychiatric illness was not his specialty. Mac's experience with postpartum psychosis and criminal responsibility evaluations was challenged. Defense counsel challenged the possibility of retention and confirmation bias. Sathoff's FBI affiliation does not make his clinical opinions inherently correct. An unusual hallucination is not the same thing as an impossible hallucination, and no prosecution expert could directly observe what was happening inside Lindsay Clancy's mind between approximately 5:15 and 6 p.m. on January 24th. One other issue should remain outside this analysis. Lindsay's Catholic faith surfaced during portions of the expert testimony. Judge William Sullivan instructed jurors to disregard certain religious references. This account will not use Lindsay's religion as evidence that she did or did not appreciate the wrongfulness of killing her children. In the end, the experts agree on more than it may initially appear. Lindsay was ill. She was profoundly depressed. She spent months seeking treatment. She experienced suicidal thoughts. She was suffering. The disagreement concerns what happened after that illness reached January 24th. Did Lindsay's mental disease cross the line from influencing her decisions to depriving her of substantial capacity to understand or control them? Resnick and Zeisel say yes. Mack, Heilbrunn, and Sothoff say no. The same treatment history, the same January 24th timeline, the same woman. Two fundamentally different psychiatric explanations. Two explanations. By the time the psychiatric testimony concluded, jurors had heard two competing accounts of what happened to Lindsay Clancy. They were built from largely overlapping records. They described the same woman, and they arrived at fundamentally different conclusions. It is worth placing those explanations beside each other, not to decide between them, but to see clearly what each one explains and what each one has to work harder to explain. Start with the months before January 24th. The broad history is barely disputed. Anxiety beginning in September, worsening insomnia, depression, numbness, repeated medication changes, suicidal thinking, intrusive thoughts, an inpatient psychiatric admission at McLean, and continued depression even after Lindsay came home. The defense reads that history as the visible foundation of a serious mood disorder progressing toward an acute psychotic episode. The Commonwealth reads the same months as proof of genuine and severe mental illness, but not proof of psychosis. Because throughout that deterioration, Lindsay's treating clinicians did not document psychotic symptoms. Does months of worsening psychiatric illness make an acute psychotic break on January 24th more plausible? Or does the absence of documented psychosis throughout those same months weigh against one appearing for the first time that afternoon? The record supports asking the question. It does not answer it. Closely related is the clinical history itself. Dr. Jennifer Tufts did not observe psychosis. Rebecca Gelata did not observe psychosis. Clinicians at McLean did not observe psychosis during several days of inpatient treatment. And on January 23rd, the day before the killings, Tufts again documented organized thinking and no psychotic symptoms. The defense responds that psychosis does not have to exist continuously. It can emerge acutely. It can wax and wane. And Resnick suggested Lindsay may have minimized some psychiatric symptoms because she feared losing access to her children. The Commonwealth responds that this is not one clinician missing one symptom during one appointment. It is months of treatment involving multiple professionals, several days of inpatient observation. And still, no documented hallucinations, no delusions, no psychosis. How much weight should that history carry against the claim that a first acute psychotic episode emerged the following day? That is one of the central questions in the case. Then there are Lindsay's internet searches. During the final days before the killings, her phone was used to search terms involving ketamine for suicidal ideation, postpartum psychosis, psychosis symptoms, schizophrenia, hallucinations, sociopathy, intrusive thoughts, and benzodiazepine withdrawal. The defense sees those searches as contemporaneous evidence of someone frightened by unfamiliar psychiatric symptoms and trying to understand what was happening to her. The Commonwealth emphasizes a basic limitation. Searching a psychiatric condition does not establish that the person performing the search is experiencing it. The prosecution also argues that the searches demonstrate Lindsay had encountered psychiatric concepts before later describing her symptoms. But there is no established evidence that Lindsay was researching how to construct a legal mental health defense. That inference would go beyond the record. So what do the searches mean? Are they contemporaneous traces of emerging symptoms? Or evidence of a severely depressed woman researching possible diagnoses, medications, and psychiatric conditions? The searches themselves cannot tell us. Then there is January 24th. Lindsay took Cora to a medical appointment, cared for the children, built a snowman, communicated with Patrick, used Apple Maps, called CVS, ordered dinner, arranged 2 errands, and returned Patrick's telephone call from the pharmacy in a way he described as coherent. The Commonwealth sees organization, planning, preserved reasoning. The defense sees activities a mentally ill person remained capable of performing before what it says was an acute psychotic episode. Under the defense theory, Lindsay did not need to be psychotic that morning, or during the CVS call, or while ordering 3V. The alleged break could have occurred afterward. Organized behavior is not automatically proof of criminal responsibility. But serious psychiatric illness does not automatically make organized behavior irrelevant either. The question becomes, when does organization become evidence that someone retained substantial capacity to understand and control her conduct? That is a legal judgment the experts can inform. They cannot make it for the jury. Then there is the voice. Within the first 2 weeks after the killings, Lindsay had described a male voice to at least 2 people whose testimony was presented to jurors. On January 31st, Chaplain Sheila Kavanaugh said Lindsay described a persistent male voice connected to a command and the safety of herself and the children. On February 6th, Patrick heard Lindsay describe a male voice telling her that she had to act or would lose her chance. Later, forensic evaluators heard versions of the same central claim. The defense emphasizes how early those disclosures occurred. Lindsay did not wait years before claiming she heard a voice. Zeisel's psychological testing showed no evidence of malingering. Resnick accepted the hallucination as genuine. The Commonwealth focuses instead on the shape of the reported hallucination. No voice had been documented before January 24th. It appeared once. It remained constant. It repeatedly delivered essentially the same command. It stopped after Callan died. And it never returned. Heilbrunn and Sothoff found that pattern highly atypical compared with psychosis they had encountered clinically. Heilbrunn went so far as to consider exaggeration or fabrication possible. So 2 different questions emerge. Does Lindsay's relatively early disclosure make fabrication less likely? And if so, how much weight should that carry against a hallucination pattern prosecution experts considered clinically unusual? Again, the evidence allows both sides to make an argument. It does not provide a recording of the voice itself. Then there are the inconsistencies. One account placed the beginning of the voice at approximately 5:15 p.m. Another placed it at approximately 5:34 p.m. That is roughly a 19-minute difference, and the entire sequence inside the house occurred during a relatively narrow period. Lindsay also told Sothoff that she was near the refrigerator preparing chicken nuggets when the voice began. Patrick testified that when he left the house, Dawson was already sitting on the couch eating chicken nuggets. Crime scene photographs were presented that Sothoff considered consistent with Patrick's account. Some details involving Lindsay's later description of medication ingestion also varied. The defense has an explanation for discrepancies like these. Memory is imperfect. Trauma can affect recall. Lindsay suffered catastrophic physical injuries, and some forensic interviews occurred years after January 24th. A discrepancy concerning one detail does not necessarily destroy the central account. The Commonwealth responds that not every discrepancy is peripheral. If the claimed hallucination is the defining psychiatric event, a 19-minute difference concerning when it began may matter considerably when the entire event itself occurred within a short window. Neither explanation automatically wins. Traumatic memory can be imperfect, and inconsistent accounts can also reduce reliability. The question becomes, which differences are ordinary variations in memory, and which are material enough to change how much confidence the jury places in the account? Then there are the choices Lindsay says she made inside the house. Her later account described Dawson first, Cora second, Callan last. The alleged voice, according to Lindsay, commanded her to kill the children and then herself. But it did not tell her which child first, to use the basement, to use exercise bands, how to carry out the killings, or how to attempt suicide. The Commonwealth says those decisions matter. Sathoff argues they demonstrate Lindsay retained agency over method and sequence. The defense responds that a command hallucination does not need to dictate every mechanical step. A person acting under a psychotic command may still know how to walk downstairs, use an object, perform familiar actions, or make subsidiary choices while feeling compelled to obey the larger command. So another question emerges. Does making choices about method demonstrate substantial capacity to resist the underlying act itself? That distinction sits very close to the legal question the jury must answer. Then there is Lindsay's suicide attempt. Immediately after killing the children, Lindsay injured herself, took medication in what she later described as an effort to overdose, and went through the second-story window. The defense considers that powerful support for its theory. Lindsay had reported suicidal thinking for weeks. Her later account of the command contained two parts: kill the children, then kill herself. And that is essentially the sequence that followed. But the Commonwealth's alternative theory also accommodates the same evidence. Heilbrunn believes Lindsay was profoundly depressed and suicidal. In his interpretation, she decided to die and concluded that she could not leave the children behind without her. Under that theory, the suicide attempt does not require psychosis at all. This is one of the clearest examples in the case of the same physical evidence fitting both psychiatric explanations. The suicide attempt is real. What it says about psychosis is disputed. The same is true of another reported statement, "Go to God," or "Go to God, baby." Resnick interprets those words as evidence of distorted psychotic thinking. Under his theory, Lindsay believed death was somehow protective, that killing the children before killing herself was morally right because they would be safe. Mack and Heilbrunn read the words differently. They see evidence that Lindsay understood. The children were alive. Her actions would cause death, and death carried significance and finality. One reported phrase, two psychiatric interpretations. Neither interpretation exists inside the words themselves. It comes from the expert framework placed around them. And despite all of the disagreement, the principal psychiatric experts agree about something important. Lindsay was seriously mentally ill. She was depressed. She had experienced suicidal thoughts. She spent months seeking psychiatric treatment. This is not a case in which the Commonwealth argues that Lindsay was a psychologically healthy person with no meaningful psychiatric history. The disagreement is much narrower. Even the diagnoses do not divide cleanly along prosecution and defense lines. Avram Mack concluded Lindsay suffered from major depressive disorder and rejected a bipolar diagnosis. Philip Resnick diagnosed bipolar II disorder with severe depression and separately concluded Lindsay became psychotic on January 24th, characterizing the episode as postpartum psychosis. Kirk Heilbrunn diagnosed bipolar II disorder but rejected acute psychosis. Gregory Sathoff also diagnosed bipolar II disorder and rejected the command psychosis explanation. So 3 experts can accept serious mental illness. 3 can even overlap substantially on diagnosis and still reach opposite conclusions about criminal responsibility. Diagnosis does not automatically answer the legal question. The dispute is about capacity. Resnick and Zeisel concluded Lindsay lacked criminal responsibility. Mack, Heilbrunn, and Sathoff concluded she retained it. And that brings the case down to a distinction smaller than sick versus healthy. Almost no one is arguing that Lindsay was healthy. The question is, what did the illness actually do to her substantial capacity during the killings? Did it influence Lindsay's thinking, her hopelessness, her fear, her reasoning, her decision to die? While still leaving her with substantial capacity to appreciate that killing her children was wrong and to conform her behavior to the law? Or did the illness go further? Did it deprive her of substantial capacity in either of those respects? That distinction is the case, and the legal burden matters. Lindsay does not have to prove that she lacked criminal responsibility. The Commonwealth must prove beyond a reasonable doubt that she was criminally responsible. Because lack of criminal responsibility exists if mental disease caused a substantial lack of capacity in either legal respect, the Commonwealth must establish that Lindsay retained the substantial capacity required by law. The experts can offer opinions about that question. They cannot decide it. For more than 5 weeks, jurors heard Lindsay Clancy described from nearly every available direction. Patrick, her parents, other family members, doctors, nurses, therapists, hospital staff, digital forensics analysts, investigators, psychologists, psychiatrists. More than 70 witnesses testified before the evidence closed. Each added another piece to an unusually detailed record of Lindsay's life before, during, and after January 24th. On August 26, 2026, testimony ended. The psychiatric experts had given the jury their answers. Now the witnesses were finished. The following day, the lawyers would stand in front of the jury and make their final arguments about what all of that evidence meant. After that, the question would belong to 12 jurors.